Kim.
Yesterday morning when you greeted me.
Oh, so it's on the 4th floor. So if you go to the 4th floor, so it used to be the like cafeteria food court.
Is this hearing?
Supervisors, we are live at this point.
Okay.
I always like to wait till we're live to ask questions.
All right. With that, I will call the regular and redevelopment successor agency meeting of the January 12th, 2021 board meeting to order. I will ask the clerk to please call the roll.
Thank you, Chair Fletcher. Before I call the roll, I would like to note for the record that all 5 supervisors are participating via teleconference. As such, all votes will be handled by a roll call vote. Additionally, before we begin, any members of the public that wish to provide oral testimony during today's meeting, please review the instructions posted on the Clerk of the Board's webpage. I'll remind members of the public that have requested to speak to wait to dial into the meeting until the item is called. With that, I will now call the roll. Supervisor Anderson?
Here.
Supervisor Lawson-Remer? Supervisor Desmond?
Here.
Vice Chair Vargas?
Present.
Chair Fletcher?
Fletcher here. We will now move to the invocation, pledge, and proclamation. If everyone would please stand, we will begin the invocation, followed immediately by the Pledge of Allegiance. The invocation this morning will be delivered by my dear friend, Rabbi Lori Koski, CEO, San Diego Continuing Education Foundation, followed by the pledge, which will be led by me. Rabbi Lori, thank you very much for joining us. We will turn it to you.
Thank you, Chair Fletcher. I'm so happy to be here this morning. Good morning to you all, Chairman Fletcher, Vice Chair Vargas, supervisors, county staff and leaders, and community members. This morning we come with hearts deeply thankful to our County Board of Supervisors for all of their endeavors supporting the residents of our county. Indeed, we all come from many places, backgrounds, ethnicities, and by many paths. Yet we all come here inspired by a singular mission to struggle for the well-being of all those who inhabit this beloved county that we call home. Our newly elected chair and vice chair assume their new responsibilities to lead San Diego County. May they be empowered to bear their responsibility of leadership with the utmost of integrity and humility. May our supervisors be inspired with courage, wisdom, and compassion, that they may stand in solidarity with those who are disenfranchised and left behind, defeat historic and systemic inequities, and unify our county. May they be guided to know and to do what is right, and to challenge and defy anything at all that would diminish justice in this county, in this state, in our country, and with our neighbors. May we all view this remarkably painful and appalling moment in our country's history as an invitation to move forward with purpose and intention, with the work of repairing a world filled with injustice, racism, and intolerance. May you continue to pursue with all haste effective strategies to ending the suffering of the pandemic for those who are afflicted by illness and all who are afflicted by necessary public health measures. Let us all be occupied as you are with lifting the lives of people around us and healing our families and communities. May our intentions be sincere, our labor selfless, and may our beautiful San Diego County, under your leadership, become a shining example for all to follow. And let us all say, Amen.
Thank you very much. Please join me in the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all. Thank you, Rabbi Lori. We will now proceed with our proclamations. The only proclamation we have for this morning is one I'm proud to present to the San Diego chapter of the Black American Political Association of California. Accepting this recognition and proclamation will be BAYAC San Diego Vice Chair Elise Pipkin Allen. January 18th upcoming is Martin Luther King Jr. Day of Service, and in recognition of this upcoming important holiday, I want to honor the San Diego chapter of the Black American Political Association. Martin Luther King Jr. fought hard against racism. He fought hard for civil rights, for issues of equity and fairness and justice. And it's obvious that there is so much left to be done in our country combating systemic racism. Today, Supervisor Vargas and myself are bringing forward a resolution declaring racism a public health crisis in San Diego County. We must tackle this issue head on and at its root. We must call out the severity of racism so we can be intentional in the way that we approach this issue and the way we ensure the basic promise of equality of access to the American dream for all. Racism is a public health crisis, and we should approach it as such. On the front lines for so many years of tackling these issues and leading and fighting for the community is BAYAC San Diego, and they nobly and proudly carry the legacy of Martin Luther King Jr. in their important work, challenging the people and practices that contribute to systemic inequities that leave the Black community disproportionately marginalized. They work to reject the toxic culture of white nationalism, calling it out at every opportunity and in front of every audience. BAYAC is devoted to ensuring that the economic, social, and political force of the Black community here in San Diego County remains centered and relevant. They work to find a forum for their members to identify issues, find solutions to the issues related to jobs, education, and healthcare. They work to push and hold accountable elected representatives to ensure that we are in tune with the needs of the community and are taking action. And I know that they will continue long into the future to define ways and means for additional political and community empowerment. With us here today is Elise Pipkin Allen, the Vice Chair of BAYAC San Diego. It is my distinct privilege as chair on behalf of all of the Board of Supervisors on this 12th day of January 2021 to declare this to be BAYAC San Diego Day throughout San Diego County. Thank you and congratulations. I'd like to turn it over to Elise to say a few words.
Can you hear me?
We can hear you.
Thank you so much. I accept this proclamation on behalf of BAYAC San Diego. I am the Vice Chair of BAYAC, and I accept it on behalf of our members, Abina Stevenson, Dinah Goodspeed, Janine Cordes, Ken Marlborough, Ken Merrill, and Gregory Mitchell. BAYAC was established in 1979 in San Francisco by Dr. Percy Pinckney and Mayor Brown and a lot of other activists across Southern California. BAYAC Chapter of San Diego is a visionary movement that works to ensure the Black community in San Diego County remains a relevant economic, social, and political force in Southern California. I want to especially thank Supervisor Nathan Fletcher for resurrecting the Leon Williams Human Relations Commission. I worked for the county and I retired from the county and I was there with Leon Williams. And I have not felt so connected with the Board of Supervisors since Leon left until Nathan Fletcher was elected. I appreciate all the work he's done. We are very excited about racism being considered a health issue because it is. And we are especially excited again about the Human Relations Commission, which is chaired by our chair, Ellen Nash. Again, thank you so much, Nathan Fletcher, Supervisor and Chair. And thank you, Nora Vargas, and all of the new members and the old members. The County of San Diego has now become, in our minds over here in Southeast San Diego, just as important as City Council. And that hasn't happened since Leon Williams. So again, thank you for this proclamation. We are very excited about it and thankful.
Thank you so much, Elise. Please give our best to Ellen and everyone at BAYAC.
I sure will.
Well,
Thank you so much.
thank you. Next on the agenda is non-agendized public comment. This is an opportunity for the public to address the board on subject matters that are within the board's jurisdiction, but not on today's agenda. The only action the board may take in response to non-agendized public comment is referral to the Chief Administrative Officer. I want to provide a reminder, according to Rule 4A, members of the public that are non-English speakers and need interpretation assistance will get twice the allotted time for their comments to ensure time for appropriate translation. I will ask the clerk if we have any requests to speak on non-agendized public comment.
Thank you, Chair Fletcher. We have 12 requests to speak on matters not listed on the agenda. Any members of the public that have requested to speak during non-agenda public communication, please dial into the conference line now using the instructions provided to you. As a reminder for the callers, if you requested to speak on a specific agenda item, please hang up and call back when the board begins discussion of that item. We will begin calling speakers by the last 4 digits of their phone number, and you'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record, and you'll have 2 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. And I'll remind the public speakers that they should mute their TV or live video stream before they begin speaking. Aaron, if you could please identify the first caller.
Yes, our first caller is 5635.
Good morning, Chair Fletcher and members of the Board of Supervisors. My name is Max Espinoza, and I'm a resident of the County of San Diego. My parents are residents of the City of Escondido and Supervisor Lawson Reamer's district, and I am here as their voice today. My mother is a hardworking essential worker and has underlying health conditions that put her at great risk during the public health pandemic. My father also has underlying health condition and is staying at an assisted living facility that now has a full-blown COVID outbreak where residents have died as a result. For many weeks now, as the county's COVID-19 cases have risen dramatically and the death toll rises, a number of restaurants in the city of Escondido and throughout the county are not only open, but still allowing dining inside and outside, skirting public health orders and guidance. For example, Tony's Pizzeria on the corner of East Grand Avenue and South Juniper in Escondido has been flagrantly thumbing its nose at state and county public health orders. This is clear to anyone walking or driving down Grand Avenue in Old Escondido, all while the county's most vulnerable residents, working class and essential workers like my parents, continue to suffer the brunt of this pandemic. Like other areas of the county with similar demographics, Escondido has one of the highest concentrations of working class people and COVID-19 cases in the entire county of San Diego. The disproportionate economic and racial impact of this pandemic is obvious to anyone who cares to look at the data. I know you are working to reset the county's agenda, and that will take time. While those efforts continue to roll out and take form, I plead with you to do more on the public health order enforcements, using all the tools at your disposal, including administrative measures such as withholding grant funds and working with the county's cities to not renew business licenses for flagrant violators. The county can ensure equitable business practices and support small businesses by not allowing scofflaws to unfairly make a profit on the back of the most vulnerable residents. Do not allow businesses to continue to thumb their nose at you and the county's most vulnerable communities, while people continue to die in record numbers and many more fight for their lives. The new Board of Supervisors has an opportunity to implement a different direction that makes clear to the county residents, especially people like my parents, that they are a priority. I ask you to protect people like my parents who cannot speak to you today. Thank you for your consideration.
Thank you.
Thank you. Our next speaker is 3800. 3800.
Hello, my name is Barbara Gordon. What brings me to the Board of Supervisors this morning is, as the adult leader of a Hispanic youth group, I applaud the Board of Supervisors for their incredible leadership in banning the sale of tobacco products in the county. Using flavors like cotton candy, bubble gum, gummy bears have created an epidemic of e-cigarette use among our youth. I hope the county will show that same leadership and continue to not allow marijuana businesses in the county. We know vaping is how our teens are using marijuana. Vape cartridges are the most sold item at marijuana businesses. Sandag reports 78% of juvenile arrestees reported ever vaping THC. The U.S. Drug Administration has issued warnings related to vaping any products that contain THC. Protecting our teens from the consequences of marijuana addiction is paramount. Marijuana vape products contain enormous amount of THC that completely rewires adolescents' developing brain, creating irreversible cognitive changes and potentially leading to years of further addiction. Please continue to put our young people's well-being first before marijuana industry that promotes addiction. Thank you.
Thank you. Our next speaker is 7613. 7613.
Good morning, Board of Supervisors. My name is Becky Rapp. I'm a mother to 3 teens and a youth group mentor. I wanted to take this opportunity to thank you for upholding your policy against permitting any marijuana dispensaries in the unincorporated areas of the county. Marijuana businesses market on social media using bright colors and fruity flavors, actively targeting our kids. Their mission is threefold: start them early, increase frequency of use, and increase potency. It's no secret that anxiety and mental health issues are on the rise. Teens are resorting to unhealthy outlets such as marijuana use. Recently, Dave King, Executive Director for San Diego Imperial Valley High Drug Trafficking Area, or HIDA, stated, "We are in the midst of a vaping epidemic. Emergency department visits and admissions for any related marijuana misuse has increased by 89%, and hospitals are seeing on average 29 discharges a day due to marijuana, and it remains the primary drug of choice for youth ages 12 to 17. Marijuana is becoming so highly commercialized, it's crucial the county continue to send a clear message of avoidance. Thank you."
Thank you. Our next speaker is 6784. 6784.
Good morning. My name is Marty Martinez. Last week, hundreds of thousands, if not more than 1 million people gathered in Washington, D.C. to show their concern that the November presidential election was fraught with illegal and criminal activities which influenced the outcome. I share the same concern based on the time I've spent reviewing the claims and the data, which includes the following: testimony to the Georgia legislature by a nonpartisan team of information system and statistical experts, last-minute election rule changes put in place by non-legislative bodies, improper signature verification procedures, poll workers being barred from doing their job of oversight, and state governments not turning over voter machines for audit. This is just a partial list. These were all legitimate claims that I believe were given to the Congress to do their constitutional duty and demand the states address the claims with the presentation of the data to the American people, along with lawful evidentiary hearings. Not surprisingly, Congress failed in their duty, and suddenly they are appalled at the violence and destruction caused by a group of agitators that probably represented 0.1% of the mostly middle-aged Americans that showed up last week. Where was Congress's concern last year when so many lives were lost and so much property was destroyed? Their silence was deafening. Violent demonstration is wrong no matter what ideology one chooses to believe. Freedom of speech through civil discord is a constitutional right. The violence we have been witnessing, however, is just a distraction. The real focus must be directed at free and fair elections. Free and fair elections are the cornerstone for this Republic of the United States of America. I hang my head in shame to any soldier who spilled their blood in defense of this Republic over the way our Congress failed in their duty to uphold the sacred right of the people to choose their leaders. To ensure free and fair elections, I request that the County Board of Supervisors take as an action and framework for our future to include an agenda item each week.
Thank you, sir.
Okay, thank you.
Thank you. Our next speaker is 1822. 1822. 1822, you need to press *6 to unmute yourself. And if we don't hear from you, we will come back to you. Our next speaker is 7234. 7234.
Good morning, Board of Supervisors. My name is Terry Ann Skelly. Recently, the local newspaper in District 3, where I live, printed an article from Sandag regarding youth marijuana use. Cynthia Burke, Sandag's Director of Research and Program Management, said in the survey found youth have changed their attitudes about marijuana over the past decade and have become less concerned about any potential harmful effects. In 2007, surveys found 42% of youth said marijuana could be extremely bad for someone, while only 17% thought the same in recent studies, she said. While youth reported that they've tried alcohol before any drug in their past, the recent surveys show 58% of young people said they tried marijuana first. As a resident of District 3, I am concerned about the number of marijuana billboards all around the county and the messages they send to vulnerable young people. These billboards are contributing to the lax attitude by youth about marijuana. These billboards appear on all the highways in the county. They do not introduce our visitors or citizens to a county whose goals are good health and safety for all. As a mother of 3 young adult men whose lives have been dramatically disrupted by COVID, I am very troubled with these billboard messages that marijuana use is some sort of panacea for anxieties and other problems. I respectfully ask that the Board of Supervisors keep these billboards out of San Diego. Thank you.
Thank you. Our next speaker is 3187. 3187. You need to, oh, here you go.
Yes. Hello?
Hi there.
Do I speak now?
Yes, you may proceed.
Hello, my name is Armand King, COO and co-founder of Paving Great Futures. I just wanted to say congratulations to all of our new county board members and to the newly appointed chairman of the county board, Nathan Fletcher. We appreciate you. I definitely appreciated you coming out and seeing what we do here with our COVID relief firsthand in Southeast San Diego. You know, you see firsthand that we are feeding not just this community, but feeding communities throughout the county. On an average of 2,000 individuals are fed just from our Tuesday distribution alone. COVID-19, you know, we all expected it just to be a 3-week blink, but it turned into a 9-month, really transformation of minds and the way we operated. We are feeding upwards of 10,000 people monthly, individuals throughout the county through our many different distributions. I'm just here to say, please, let's find it within our budget to pay for what the services that we are providing to the individuals and people in grave need of these services. I don't see this being a problem. So I know we're going to figure it out. I have great faith in this board, and I know we will find it within our budgets to take care of the individuals that are putting their lives on the line, as well as to continue the services that we're doing. We're going to do it regardless. We're here for the people. We've been boots on the ground since day one, and we're not going to stop. But some services and some support from our county that truly believes in the work we're doing and believes in the people, I know is going to come. That's all I have to say, and I appreciate you all, and I hope the rest of this meeting is a blessing. Thank you.
Thank you. And we'll go back to speaker 1822. 1822, if you'd like to address the board on non-agenda public comment, this is your opportunity.
Good morning, supervisors. My name is Peggy Walker. In your inaugural acceptance talks, all 3 of our new members addressed COVID as a major challenge, promising to address inequities in healthcare and to promote an evidence-based approach to the pandemic. I applaud you for this dedication to public health, especially to our most vulnerable communities. In this quest, I would suggest that you consider what experts conclude, that more serious COVID outcomes are likely to occur among those who smoke and vape. In my work with the County Tobacco Control Coalition, we know that smoking and vaping are extremely high among youth and young adults, and sometimes higher in minority communities. We know that those who smoke and vape inhale 30 to 50 chemicals, many carcinogenic, high levels of toxic metals and high levels of THC never meant to enter the lung. Just this past month, the County Health and Human Services Agency offered a community health improvement plan addressing the 7 most important issues to address inequities in healthcare. Number 3 was to stop tobacco, alcohol, and other drug use. I know that several previous speakers have addressed drugs. There couldn't be a better time than this pandemic to take a close look at the steps needed to address health inequities in San Diego in this Health and Human Services Improvement Plan available online. I urge you to consider how this board can improve alcohol, tobacco, and drug policies to contribute to the Health and Human Services Agency's goal of creating healthy, thriving communities and to avoid policies that may be harming, even enticing use by children and young adults. Thank you.
Thank you. Our next speaker is 6484. 6484. Please press *6 to unmute yourself.
Greetings. My name is Sister Mary Muhammad, and I'm calling on behalf of I Am My Brother's Keeper, Student Minister Abdul Walila Muhammad, otherwise known as Hugh. And first of all, on behalf of IMBK, I want to congratulate Board Chair Fletcher on his new position and welcome the newly elected board members. And I thank Board Chair Fletcher for his recent grant to our organization and our food collaborative, and also Supervisor Cox. But I wanted to bring up the issue of food insecurity and the hunger crisis. And food insecurity is quickly escalating to just plain hunger and desperation, and it's a growing crisis. The shortage of food and the money to buy it is a public health emergency, not only in the obvious physical sense, but the stress and anxiety are mental health concerns that add to the pain and suffering and other negative harmful consequences of those who depend upon us for help. And although we thank you for your previous grant approval, our operational budget is for just 1 month is nearly double that which we just received. We are an item today, a non-discussion item for the approval. So we wanted to let you know that we will be applying for a larger grant that reflects the annual budget for our food distribution collaborative, because every month we serve thousands of families with their food needs, with groceries and distributing ready-to-eat meals in our service area. And we ask the county to please look for other resources to be able to fund these efforts so that we can be able to feed the people, which we do regardless to race, creed, color, or religious orientation, and be able to help people with a growing crisis, which is food insecurity in our community. Thank you very much.
Thank you. Our next speaker is 4889. 4889.
Happy New Year, and congratulations to County Supervisor Chairman Nathan Fletcher, and to the newest members of the County Board of Supervisors. My name is Carlton Overstreet. I'm representing Friends for Friends Foundation. We are a part of the coalition with I Am My Brother's Keeper, Queen Mary that just spoke, and Brother Armand King from Paving Great Futures. We stand here meeting the needs of the community and look forward to an ongoing sustainable operation in servicing Southeast San Diego and beyond. Thank you for allowing us the platform to share our needs and our concerns on a monetary, from a monetary standpoint, but I also would like to represent the volunteers that have been boots to the ground as well, risking their health to meet the needs of serving those that are without food. Whatever can be done to support our efforts would be greatly appreciated, and we do look forward to submitting an annual budget proposal for strong consideration and high review. Thank you for allowing us to share.
Thank you. And that concludes the request for non-agenda public communications this morning, Chair Fletcher.
Thank you. Next on our agenda is approval of the minute statement of proceedings for the meeting of December 8th, 2020 and the special meeting of December 18th, 2020. I recognize that 3 members of this board are new and were not in their positions in December, but it's important to note that the action before us today is approving the form of the meetings, that they are legally compliant with the acceptable form and not the content. And so the new members of the board have full authority and is entirely appropriate for them to vote to approve the minutes for this meeting. With that, I will put a motion on the floor to approve the minutes. Is there a second?
Second.
Second, Desmond.
Thank you. We have a motion by myself, a second by Supervisor Desmond to approve the minutes. I will ask the clerk to call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Aye.
And Chair Fletcher?
Fletcher, aye.
Mr. Chairman, that motion passes unanimously with all supervisors being present and voting aye.
We'll now proceed with the formation of the consent calendar. Again, just for the public, some folks who may be new to tuning into the Board of Supervisors meeting, any member of the public, any board member, or the CAO can pull an item off of the consent calendar, which will ensure an individual discussion, comment, and vote. As we go through the board members can share if they have any items that they wish to pull. Board members will also at this point make comments if they are in support of an item that is on consent that will not be heard later, or board members can also register a no vote for an individual item consent if they choose. Before we get to the board member section, I will ask the clerk if there are any items that the public wishes to be pulled, or if there are any items that have been continued to a subsequent board meeting.
Thank you, Chair Fletcher. Item 3 has been withdrawn at the request of the sheriff. Item 4 has been pulled by the public. Item 5 has been pulled by the Chief Administrative Officer for a presentation. Item 8 has been pulled by the public. Item 9 has been pulled by the public. Item 10 has been pulled by the public. Item 11 has been pulled by the public. And item 12 has been pulled by the public. Item 21 are closed session matters that will be considered at the conclusion of the board's public session. All the remaining items on the Board of Supervisors agenda, as well as the County of San Diego Redevelopment Successor Agency agenda, may be placed in the consent calendar for your board's consideration.
Hey, Mr. Clerk, just to clarify, was item 2 continued by the sheriff or no?
I do not have that noted.
Before we begin with the consent calendar, I would make a motion to continue item 2 to the January 26th Board of Supervisors meeting. Is there a second?
Vargas, second.
Thank you. We have a motion and a second to continue item 2 to the January 26th meeting concurrent with item 3. I'll ask the clerk to call the roll.
Can I have a question? Mr.
Of course,
Fletcher?
Supervisor.
Yeah, I'm just curious from staff, is there any implications are we missing out on any grants or deadlines or things like that for staff if we delay this until the next meeting? I'm not aware if there's any complications there with the delay.
Supervisor Desmond, this is Helen. There is no concern about delaying the item 2. Item 3, assuming that comes back in 2 weeks, that would still give us enough time to apply for, with the grant associated with that, if that were to extend beyond, but that was withdrawn at the request of the sheriff.
Okay, so item 2 is fine, but there's no limits on that, or I guess we can still bring it back and later and act on it. Thank you.
That's correct. Thank you.
Thank you. Right. Any other supervisors have questions on this motion? All right. I will ask the clerk to call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
And this is just on item 2. This isn't for comments. This is just item 2.
That is correct, Supervisor.
Aye, then I for 2. Thanks.
Vice Chair Vargas?
Aye.
And Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
Thank you. So we have the list of the items pulled by the public and the ones that have been deferred to the next board meeting. Now what we will do is go to my colleagues for their comments. Supervisor Anderson, are there any items you wish to be pulled for discussion or comments to make?
Item 10, but that's already pulled by the public, so.
That's correct, yep.
So there's no additional.
All right, would you like to make a motion to approve the consent calendar?
I so move, I so make that motion. Go ahead.
Thank you, Supervisor. We'll now go to Supervisor Lawson Reamer.
I don't think 11 pulled.
11 was pulled, that's correct.
Okay, great. Then nothing further.
Got it. Would you be interested in seconding that motion?
I'll second that motion. Thank you.
All right, we have a motion by Supervisor Anderson, a second by Supervisor Lawson Reamer. We'll now go to Supervisor Desmond.
Thank you, Mr. Chair. I have no further items to pull. However, I do want to make a comment on item 1. This is the court security memorandum of understanding with the Superior Court and the San Diego County Sheriffs. I understand that the state law requires the Sheriff's Department to provide security to the Superior Court here in San Diego County, but per the MOU, it's only to the extent that funding is available from the state. However, this is significantly underfunded by the state. This MOU is less costly to the county from the previous MOU, and we're going in the right direction with this MOU. However, there's still a large gap with $8.3 million coming from the county's general purpose revenue. So the state is not providing the money that they should be, as according to the MOU. That money could be spent on local programs here that we're using to fill the gap and for those in need due to COVID. I think this is an unfair practice, and San Diegans should not be footing the bill to cover state shortfalls. So I'll support the item, but I wish for continued effort to eliminate the gap and bring it in line with the agreed to MOU. Thank you.
Thank you, Supervisor Desmond. We will now go to Vice Chair Vargas. Do you have any items to pull or comments to make?
Not at this time.
All right, thank you. I also have no items to pull or no comments to make. So with that, we have a motion by Supervisor Anderson, a second by Supervisor Lawson Reamer to approve the consent calendar. I'll ask the clerk to call the roll.
Thank you, Mr. Chair. I was just notified that Supervisor Anderson's computer is having an issue, so he has left the Zoom meeting.
I'm back. I'm back.
He's back. Okay, great. Thank you. We have a motion by Supervisor Anderson, second by Supervisor Lawson Reamer, as the chair indicated. Supervisor Anderson, your vote, please.
Aye.
Supervisor Lawson Reamer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Aye.
And Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
Thank you, Mr. Clerk. We will now move forward with the agenda items before us today. It's our intent to get through as much as we can. If we're not done by noon, we will take a short 30-minute recess at noon and then reconvene to pick up any items that are not finished. We will start with agenda item 4, receiving an update on the COVID-19 response, ratify actions in response to the local public health emergency. We will begin with the staff presentation, followed by public comment, and then board discussion and deliberation. So at this point, I will turn it over to the staff for their presentation on agenda item number 4.
And before we begin the staff presentation, any members of the public that have requested to speak on this item, please dial into the conference line now using the instructions that were provided to you. You will be muted until it is your turn to speak. Thank you.
Good morning, Chairman Fletcher and members of the board. Since our last presentation, there's been quite a few updates, including continuing rises in COVID-19 case counts, which has an impact on our local and hospital and ICU capacity. Achievements in vaccination administration updates and continued education and outreach throughout our compliance team we'll discuss today. Today's presentation will feature our public health officer, Dr. Wilma Wooten, who will provide a public health update, as well as additional information on the status of the state's tiered system. We'll then be joined by Nick Mascione, our agency director, for an update on the testing and vaccination efforts underway throughout the county. Additionally, Vince Nicoletti will provide an update on compliance efforts throughout the county and review previous board guidance. And finally, we'll be joined by Andy Pease, our Incident Command Finance Chief, who will provide an update on spending estimates. Without further ado, I'll welcome Dr. Wooten.
Thank you, Don. Good morning, Chairman Fletcher and members of the board. The epi curve that's shown on this slide shows COVID-19 cases by onset of illness and provides a historical review of cases to date. After a stay-at-home order in late March, in the middle of June, businesses were allowed to reopen. Over the following month, until the middle of July, we saw a sharp increase in cases. After a statewide restriction was imposed in mid-July, cases began to decrease, only to see a slight rebound increase in cases during the month of August. On August 31st, the new Blueprint for a Safer Economy, or tiered framework, was launched to address increasing cases. Over the next 8 weeks, cases ranged from 200 to 400 per day, ultimately seeing another sharp increase in COVID-19 cases. And on November 10th, San Diego County transitioned to the purple tier due to our high case rate and testing positivity percentage. With cases continuing to rise, on December 6th, the state implemented a regional stay-at-home order for Southern California. The incubation period, which is the last 14 days of the epi curve, has seen an exponential increase in cases. And given this is the incubation period, we know that more cases will occur during this period. Moving to the next slide, since our last presentation to your board on December 8th, an additional 100,626 cases have been reported, for a total of 194,795 positive laboratory-confirmed COVID-19 cases. These numbers are as of 11:59 on Sunday, January 10th. This table provides a summary of cumulative cases with a breakdown by age, gender, hospitalization, ICU admissions, and deaths. The age range for all cases is from 0 to 107 years of age, with a median age of about 36 years. The 20 to 49-year-old age group comprises 55% of all cases, or 107,208 of the total. Gender for all cases remains relatively unchanged since previous reports. Hospitalizations make up 3.2%, or 6,284 of all cases. 1,273 of those that are hospitalized have been admitted to the ICU, and this number is approximately 0.7% of the total number and approximately 20% of the total number of those hospitalized. Also, the total number of cases includes 1,857 deaths, which is 1% of all cases. All of our information, statistics, demographics, and other information can be found on the county's www.coronavirus-sd.com website. Now, as previously stated, in September and October, daily case counts were in the 200 to 400 range. On November 6th, we saw daily cases in the 500s. On December 25th, reported cases were over 2,000 daily. Case counts have continued to rise, going to 300 to 400 cases reported daily. Last Friday, we surpassed a sobering threshold of 4,550 cases in one day. In addition to the continuing news about COVID-19 daily case counts, there is also a new viral strain circulating. Scientists have labeled this new strain as B117, which was first detected in the UK in December, but tracked back to September. Next, it was detected in the US, specifically in Colorado on December 28th, and 2 days later, it was detected in San Diego County on December 30th. As of January 11th, 8 states and 47 countries have identified the new variant. And in San Diego County, we have had 38 confirmed cases reported. Preliminary information shows that the virus spreads more rapidly. According to UK health officials, this strain is about 40 to 70% more contagious. However, there is no current evidence that the B117 causes more severe illness or increased risk of death, and vaccines are likely to also work against this new strain. The County of San Diego has sequenced about 1.5% of its cases, or 3,000 specimens. Scripps Research Institute and the Helix Illumina Partnership are the two entities currently conducting whole genome sequencing in San Diego. Due to the recent large number of cases, the sequence samples are now being performed, the whole genome sequencing is now being performed with cases, or rather specimens, from our county public health lab, cases associated with outbreaks, and other various hospitals and clinics. It is our county goal to increase sequencing. UCSD, Family Health Centers of San Diego, Sharp Health System, and our public health lab will set aside a percentage of specimens for sequencing. And additionally, we are in the process of building sequencing capability in our county public health lab. The bottom line is that all mitigation measures currently used will be effective against this new strain. But increased transmissibility requires greater participation and compliance with those or these preventive measures. So staying at home is even more important if the B117 viral strain becomes the more dominant strain. The county is working with Dr. Natasha Martin, who has presented to your board previously, to develop modeling projections given this new strain and combine with our current vaccination efforts. Due to the continuing rise in COVID-19 cases across California, on December 3rd, the state implemented a regional stay-at-home order to stop the surge of COVID-19 cases and prevent a strain on our healthcare system. The state's health officer order is implemented if the region's ICU capacity is less than 15%. All counties are categorized based on 5 health officer regions, and collectively an ICU capacity metric is calculated for each regional coalition. And these regional coalitions are seen at the lower left of this slide. San Diego County is included in the Southern California region, along with 10 other counties as listed. The regional stay-at-home order will be lifted after the state's 4-week projection shows the regional ICU capacity being more than 15%. Currently, Southern California is 0%. The intent of the order is to limit mixing with other households that could lead to COVID-19 spread, more cases, more hospitalizations, ICU admissions, and outbreaks. The order does allow access to critical services and allows outdoor activities to preserve a resident's physical and mental health. While being in another stay-at-home order is taxing, this action will help ensure that those who need care can get it, since hospitalizations and ICU admissions are increasing at an alarming rate. To review our ICU capacity, the reduction of ICU admissions is the rationale for the stay-at-home order. This figure shows the status of our non-federal hospital adult and pediatric ICU beds. The number in the blue bar shows the number of patients in an ICU bed for COVID-related reasons. The numbers in the orange bars are for patients in ICU beds for non-COVID-related reasons. These two components currently represent 85% of ICU bed capacity of 781 beds. The number in the green open box shows the number of beds that are staffed and immediately available to take patients. As of January 10th, the hospital system only had 40 of these types of beds that were staffed and immediately available for a patient to be admitted. This number represents 5% of the ICU bed capacity. Lastly, on December 28th, the California Department of Public Health issued an all facilities letter reminding hospitals of the need to develop and implement crisis care continuum guidelines in response to the current surge in COVID-19 cases and the decreasing ICU bed capacity. This guideline, developed by each hospital, provides information related to resources that can assist in implementing the continuum of crisis care. Crisis care occurs when resources such as beds and staff are scarce and the focus shifts from providing the best care for the individual patient to delivering the best care for the patient population. Hospitals must notify the California Department of Public Health with their local health departments when crisis care is implemented. As of January 11th, yesterday, all San Diego hospitals have submitted their crisis care plans to public health, and no local hospital has activated a crisis care plan. Links to each hospital plan is posted on our county's crisis care webpage. It is now more important than ever to effectively control the spread of the virus, as this would allow our hospitals to continue to meet the needs of our communities. In closing, we start the new year with the recognition that many of our family members, friends, and neighbors are no longer with us because of this pandemic. The surge in cases throughout the nation, state, and in San Diego County is real, and we can do something about it by staying at home and following the preventive strategies recommended in this slide. In alignment with CDC and the state, please wash your hands, watch your distance, and wear your facial covering or mask. If you are sick, isolate at home and get tested. Today, if you have not received your influenza vaccination, get vaccinated. And when it is your time to receive the COVID-19 vaccine, get vaccinated. Again, these same actions are factors that will continue to help all San Diegans be COVID safe. We recognize that staying at home for many weeks is a sacrifice, but if every San Diegan did this, we could save lives and reduce stress on our healthcare system. As a county, region, and state, we can come out of this in a way that saves lives and puts us on the road towards economic recovery, as there will be no true economic recovery until the virus is gone. Now please welcome Agency Director Nick Mescione.
Thank you, Dr. Wooten. Good morning, Chairman Fletcher, members of the board. I want to provide a brief recap of the vaccine process, starting first with how COVID-19 vaccines arrived to our county and are made available to healthcare providers to administer them to San Diegans. First, CDC, the Centers for Disease Control and Prevention, are part of the federal government, and they allocate vaccine doses to our state through the California Department of Public Health, or CDPH, as we refer to it. CDPH determines the amount of vaccine to be made available to local regions, like our county. In addition to the County of San Diego's Public Health Department, hospitals, clinics, cities, and other organizations that meet the state's requirements can apply with the state to become a COVID-19 vaccine provider. In turn, all of these approved vaccine providers can order direct shipments of vaccine from the state, or in some circumstances, they can coordinate with our county if they need help to receive vaccine. In addition, there are entities that coordinate directly with the state or CDC independent of the county to receive vaccine. These include what's called multi-county entities, such as Kaiser Permanente of Southern California or UCSD San Diego Health. Federal entities, such as our local military and our VA health system, and the pharmacy partnership program that's vaccinating our skilled nursing facilities throughout the country, including in our own county, and long-term care facilities. Now, how the vaccine is administered is based on recommendations established by the CDC and CDPH. And yes, we do have a local clinical advisory body made up of physicians and nurses and other experts that look at these recommendations. But these are the recommendations we, this county, are following. And as you can see in this chart, currently, CDPH has approved all healthcare personnel in Phase 1A to get the vaccine. What does this mean? It represents nearly 635,000 individuals that are healthcare professionals, and we're recommending to every one of them who fall in this group to contact their medical provider to schedule a vaccine. And if there's any issues where they can't, because their provider doesn't have it or is not ready, they can visit us, our website, at www.vaccinationssuperstationsd.com. This is like a Comic-Con kind of website, but it's great. Vaccinationssuperstationsd.com. And if you go to that website, for these folks that are eligible right now, You will find county-sponsored vaccination events held throughout our entire county, including the Super Vaccination Station at Petco Park, which just kicked off yesterday and did 3,200 vaccinations, and on their way to reach 5,000 vaccinations per day, 7 days a week by week's end. We have also, in addition to drive-up vaccinations, we have walk-up vaccinations for those that don't have a vehicle. And it's important to note that they're all appointments that are required and space is limited. Now, we're actively working to add more appointments to all of our locations, as well as expanding additional vaccination events throughout the county, just like we did with T3 in our testing sites, which is, and very importantly, driven by what the data tells us where the need is, using a very strong health equity lens. We're updating this information of additional appointments and locations almost daily. And that's why I encourage folks to visit the website of www.vaccinationsupestationsd.com. And we encourage the public to check the website regularly so they can see what is available for them. As we go to the next slide, we are accelerating our efforts to vaccinate those in Phase 1A. And I will tell you, this is a huge collaborative effort of our hospital partners, our clinics, several of our cities, and clearly a leadership role of our county. And we're doing this because we want to move quickly, protecting Phase 1A, but we want to move quickly into Phase 1B. And although I can't provide you a precise timeline, we do anticipate starting Phase 1B, Tier 1, in several weeks. And the major categories include individuals 75 years and older, and those at risk of work exposure in the following sectors: education, childcare, emergency services like law enforcement or sheriff, and food and agriculture as just major examples. Now, looking ahead, we're continuing to ramp up our regional vaccination workforce. You see, we need more vaccinators even as we add more sites. And so this is going to include, and we've been hard at work, expanding our existing county workforce, to leveraging with our great hospital and clinic and city partners, and to enlisting medical volunteers to step up and help. It's an all-hands-on-deck approach in building the workforce both for vaccinators and the support staff, the data and everything else that's involved to stand up these amazing sites. As it relates to data, we're trying to collate the different reporting sources to develop a single county data dashboard that shows how many San Diegans have been vaccinated with their first and their second dose, as well as some other important health equity data points. And lastly, using our many sources of community engagement, from our community partners that we have to our media campaign, we are encouraging all San Diegans to receive the COVID-19 vaccination. And we're, very importantly, developing a customer portal where the public can go and get the latest information as to their status of when and where they can receive their vaccine. I just want to end by reiterating what Dr. Wooten just mentioned, is that while we're rolling out the vaccine over the coming weeks and months, we must still follow the public health guidelines to wash your hands, maintain space, wear a mask, stay home if you're sick, and get tested at any one of our 41 testing locations offered by the county just in this month. And if you've not received your influenza shot, as Dr. Wooten mentioned, get vaccinated, because there are some folks that are getting co-infected with COVID-19 and influenza. We want to avoid that. And when it's your turn to receive COVID-19 vaccine, please get vaccinated. It's safe, it's highly effective in protecting your health, that of your family and our county, and it's also our direct path to reopening our entire economy. So with that, I'd like to turn it over now to Vince Nicoletti to provide an update on the engagement with businesses. Vince?
On August 4th, the county established the Safe Reopening Compliance Team to serve as the regional lead for complaints regarding possible violations of the public health order. To date, the team has received over 17,000 complaints, working with cities across the region to address them. 9,000 of these complaints have been received since our last update to the board on December 7th. The team includes a call center that's staffed 24/7 for which complaints are anonymous. We also respond to emails received. We've trained team members on approach with the intent of helping businesses or entities navigate the health order and come into compliance. The August 4th board direction for the compliance team was to address egregious cases, those that are willful or sustained violations of the health order, follow-up inspections for locations with outbreaks, as well as complaints for operations that are prohibited under the health order, such as an indoor fitness center or dining. Additional options presented on August 4th, but not implemented, included responding to complaints of operations not fully complying with their safe reopening compliance plan, such as a store not strictly requiring masks. The concept of proactive inspections was also considered, but not selected. This chart shows our average daily complaints each week since the Safe Reopening Compliance Team was established. Each bar represents the average number of complaints received each day of that week. The average daily complaints has ranged from 40 to 50 for most of the time. However, following our move into the purple tier restrictions, daily complaints increased significantly and have averaged 200 to 300 in recent weeks. Since shifting into the purple tier, roughly 75% of complaints are regarding an entity which is operating that is prohibited or restricted in some manner under the health order. An example would be indoor operations that were prohibited, such as a gym or fitness center. 25% of complaints are regarding an entity not complying with their safe reopening plan. The team remains committed to the August 4th board direction, focusing on those complaints that are operations prohibited or restricted under the health order. As a result of increased complaints and violations upon entering the purple tier starting in late November, the county expanded the Safe Reopening Compliance Team to add staff members from the Sheriff Department and District Attorney to help resolve violations more swiftly. The expanded team is a regional presence addressing violations within cities as well as the unincorporated communities. Team members from the Sheriff are now embedded as part of the compliance team. The combined team has a field presence 7 days a week. The District Attorney Office has also increased involvement with the team. We've also seen cities increase their enforcement presence, looking to revoke the right-of-way permits for businesses not complying with the health order, as well as issuing citations for violations. In addition, we share cease and desist orders for entities with an ABC license with California Alcohol Beverage Control, so the state may also take action. Since the compliance team was established, the goal has always been to resolve violations with voluntary compliance. This has been accomplished for the majority of cases to date, and most businesses are complying before the complaint is even filed. The compliance and enforcement process is unique for each case. However, the process typically starts with contacting the business or entity in question. Site visits are conducted as well as education, including what steps need to be taken to navigate the health order. Staff look for options to modify business operations to resolve the violation, as well as share resources that may be available to assist businesses. When it's determined that a violation exists, the compliance or entity does not come into compliance, a cease and desist order may be issued. Following issuance of a cease and desist order, the compliance officers will remain in contact with an entity in violation and monitor for any changes that may resolve the violation. When monitoring shows a violation continues, the compliance team schedules a joint inspection with the embedded sheriff team members. If the joint inspection shows the violation still exists, the Sheriff's Department may issue a citation or submit the case to the District Attorney for review. Following movement into the purple tier on November 14th, there was a sharp increase in cases where compliance was not achieved after initial inspection. To date, we've issued 335 cease and desist orders. As we continue to do follow-up inspections for locations that have received these cease and desist orders, we're finding that within a few weeks of receiving the order, roughly 2/3 are coming into compliance and 1/3 continue the violation. For the 1/3 that remain in violation, the Sheriff Department is referring cases to the District Attorney. This slide summarizes the existing scope of the compliance team, focusing on egregious cases, locations of outbreaks, and operations that are prohibited under the health order. If there was interest in expanding the program to address the 25% of complaints we're receiving that do not fall within its existing scope, it would cost $180,000 for 6 months to respond to complaints for operations not fully complying with their safe reopening plan. Additionally, if there was interest to begin proactive inspections, the cost would be $30,000 to fund one position for 6 months. This completes the compliance update. Next, Andy Pease will provide the fiscal update.
Thank you, Vince. Good morning, Chairman Fletcher and supervisors. This morning, I'm going to update you on the following information: how much we have spent toward our COVID-19 efforts through December 30th, our current spending trends, one-time and ongoing, and finally, I'll provide some information on funding opportunities. I'll also cover spending trends. So in looking at this first slide, prior board action created a framework for the use of over $431 million in CARES Act and county funding through December 30th toward our COVID response and for economic and community investments. Of the $431 million, the board committed to use $390 million of CARES Act coronavirus relief funds. The remaining was covered with local general fund balance. Now, based on our estimated costs, we have fully used the CARES Act funding as well as the county dollars. I'll note that up until recently, statute required that the CARES Act funding had to have been spent by December 30th, or it was to be returned to the U.S. Treasury. However, the most recent stimulus bill just passed in late December has now extended the availability of these CARES Act funds through December of 2021. So through the end of December, we have spent an estimated $422.9 million, and we have $17.9 million in remaining one-time obligations in the area of rental assistance and behavioral health, for a total spend of $440.8 million, which is over the $431 million by $9.5 million. To cover that, we are looking for other funding sources. We're looking at how we may be able to more leverage FEMA, and we're looking at program revenue realignment and also an eye for future stimulus funds. And currently, going into this new year, based on current COVID-19 response efforts today, we are spending approximately $9.8 million a week. And that does not include the vaccination efforts that Nick just discussed. And I'll cover that in greater detail in a few minutes. This next slide shows by line item the components making up the CARES Act and county funding framework and where the dollars are being spent. The majority of the costs are dedicated to our public health efforts shown under county response and T3, test, trace, and treat. The primary areas of overspending are in T3, which isn't surprising. It's mainly for our testing and case investigation efforts. Their costs are directly correlated with the trend of the COVID virus. As cases increase and surge, these services are significantly impacted. The second main area of overspending is for the Employee Income Stipend Program, also directly tied to the surge in cases. Now, the intent of this program is to help stop the spread of COVID-19 by providing financial assistance through a one-time stipend of $1,000 for employed individuals who are confirmed COVID-19 positive and not otherwise eligible for paid time off or other unemployment benefits, to ensure that those who are sick and asked to isolate have the resources available to stay home. So let's look at the details of this framework, first focusing on our one-time investments. Based on our prior board action, $154 million were allocated for investments in these areas. Business stimulus funds, $47.5 million was allocated for small businesses impacted by the pandemic, including restaurants, and to date over 7,000 awards have been issued. I'll note that the methodology for allocating these dollars was to provide each board district an equal amount of funds, which was $9.5 million per district. For rental assistance, eligible applicants can receive up to $3,000 to cover 2 months of rent costs. We have spent about half of the funds through December, and at the conclusion of the program, we estimate between 9,000 and 10,000 families will benefit from the program. The board allocated $25 million to the 17 smaller cities in San Diego that did not receive a direct allocation of CARES Act from the federal government for their own COVID response efforts. The distribution of funds was based on percent of population, which mirrored how the CARES Act was allocated nationwide. Under the Child Care Provider Grant Program, the board invested $25 million to provide grants to over 3,300 child care providers. All providers received an equitable amount if they qualified. No eligible provider was denied a grant. $15 million was allocated to behavioral health services, ranging from investments to providers for telehealth, for infrastructure, to rental assistance for those in need, and other investments to ensure continuity of care. $5.6 million of funding went toward food banks, specifically the Jacobs and Cushman San Diego Food Bank and Feeding San Diego, providing services across the county. $5 million of funding was used to provide child care vouchers for essential workers during the pandemic, serving over 3,600 families and over 5,200 children. For child welfare services, the board allocated $2 million to be used for outreach efforts to ensure at-risk children were having face-to-face contact and were safe while schools were shut down. In addition, those funds were used to provide a temporary $160 a month stipend to foster families. Finally, the board allocated $2 million to be used to assist families and students in addressing their needs to ensure they had adequate Wi-Fi, internet, and equipment for remote learning. Working with the San Diego Foundation and the San Diego County of Education, over 4,300 students received internet access. Now, this next slide reflects where we are continuing to incur ongoing costs. The first two lines, county response and T3, these are our basic critical efforts we are taking to combat the spread of the virus and protect the health of the community. As mentioned earlier, these costs are directly correlated to the trajectory of the virus. As long as cases are high, so will our testing, tracing, and investigation efforts. In T3 alone, we are spending an estimated $6.8 million a week, of which a significant amount is for testing. We can expect that as more vaccines get administered into the community, these costs will eventually taper down. The next three items, the Employee Income Stipend Program, which I just discussed, and the Great Plates programs, are discretionary in nature. They are not mandated. Now, it's our intent, unless given different direction today, to continue providing these programs. The risk, of course, is that we may need general fund balance as we continue to look for state and federal funding to cover the cost. We have provided almost 8,000 individuals with an income stipend since the inception of the Income Stipend Program. For the Great Plates Delivered Program, this is a FEMA-eligible program that has been extended by FEMA until February 6th. FEMA renews the program on a monthly basis, and we have no reason to think that they will not renew it beyond February. This is important to note, as FEMA and the state cover over 93% of the costs, and the county only has a 6.25% share of cost of this program, which is what these dollars reflect above. Under the Great Plates Delivered program, we have approximately 4,400 seniors enrolled in the program, and they're provided 3 hot meals a day, which equates to over 92,000 meals a week. And we are utilizing almost 50 local restaurants. For the Great Plates 2 program, this program is a version of the Great Plates 1 delivered program, but only provides 1 meal a day. It is not FEMA program, so the cost is 100% county at the time, and we have over 1,250 enrolled and served about 8,800 meals. In total, again, for all these programs, we're spending an average of about $9.8 million a week, and this does not include the costs tied to the distribution and administration of COVID-19 vaccines. We are still assessing the cost impact for a vaccination plan. It is dependent on numerous factors. For instance, for the vaccination efforts at our super vaccination station in East Village, assuming we administer 5,000 vaccines a day, 7 days a week, initial estimates are that it could cost $1 million a week. However, those costs would come down, and it's dependent on the level of volunteers that aid in these endeavors. And as we gain efficiency in administering the vaccines, and of course, the net impact to the county will be determinant on third-party billing and federal and state funding. And although this sounds expensive, and it is expensive, the sooner we can administer the vaccine, the sooner our overall COVID response costs go down, and the sooner the economy can fully reopen. My final slide shows possible funding to help cover the cost for our ongoing efforts, our vaccine efforts, and also cost that funding that may support the community and schools. Last Friday, the governor published his proposed state budget for fiscal year 21-22. As part of his proposal, he included some immediate actions he is requesting the legislature to take action on now. It includes $575 million in grants to small businesses impacted by COVID, $2.4 billion to provide $600 tax refunds to an estimated 4 million low-income Californians, $2 billion to K-12 schools to assist in their safe reopening, $71 million in fee waivers for heavily impacted service industries, including those licensed by the Board of Barbering and Cosmetology and the Department of Alcoholic Beverage Control. In addition, the governor is investing in vaccine efforts, testing, and other services. Our Office of Strategy and Intergovernmental Affairs will be issuing a comprehensive analysis of the governor's proposed budget in the coming days. In late December, Congress passed H.R. 133, which is the Coronavirus Response and Relief Supplemental Appropriation Act, totaling $900 million for COVID efforts, including extending unemployment insurance, direct payments to individuals and families, as well as funding for rental assistance, testing, tracing, and vaccine distribution. In the coming days and weeks, we will learn more on how these dollars will be allocated. We know $357 million of funds will be given to California for vaccine efforts. We do not yet know how the state would distribute these dollars to the counties. Likewise, we know there's an additional $1.8 billion coming to the state to cover testing and tracing efforts. And we are working with our state associations to pursue and ensure we get our fair share of these funds for all these efforts. For rental assistance, there's $25 billion nationwide available, and any jurisdiction with a population over 200,000 can request a direct allocation. The San Diego region in its entirety is eligible for $99.9 million of rental assistance, according to estimates. $49 million is estimated to be able to come directly to the County of San Diego, $42.7 million to the City of San Diego, and $8.2 million to the City of Chula Vista. To receive a direct allocation, a jurisdiction must submit a request directly to the U.S. Treasury by today. The county submitted its request last Thursday. There is also additional funding to be allocated for mental health services and for child care providers. We're also looking at other funding sources. We're looking to see if there will be additional stimulus funds under the new administration. We're looking at any available program revenue, any available realignment. We're looking at how we can better leverage FEMA. And ultimately, we will be potentially looking at the use of general fund balance. We're also considering and looking for future philanthropic investments. During our second quarter status letter, we do anticipate we'll be coming to this board to request additional appropriations for these efforts, including our identified funding. In conclusion, I'll note that recommendation 3 in today's item includes a recommendation to amend our existing contract with Cortex Solutions, LLC, for the provision of critical geographic information system analysis, which is important in our COVID-19 and public health efforts. Also, recommendation 4 is to ratify the acceptance of the community investment agreement with Blue Shield of California Promise Health Plan in the amount of $1 million, and to fund the San Diego Care Coordination Pilot in support of behavioral health and UCSD joint venture. This concludes my update, and I'll turn it back over to you, Don.
Thanks, Andy. In addition to receiving this update, we recommend your board take the following actions with respect to this item. First, ratify all actions previously taken in response to this local health emergency and local emergency. Second, approve and authorize the Director of the Department of Purchasing and Contracting to enter into negotiations to amend the contract price and extend the contract for as-needed geographic information system, GIS, analysis. Third, ratify the acceptance of the community investment agreement executed by the Chief Administrative Officer. And finally, take any other action necessary to address the COVID-19 pandemic emergency response. Subject to your questions, that completes our presentation.
Thank you. Thank you for that presentation. I imagine we'll have a lot of board member comments and questions to consider. If it's okay with members of the board, I'd like to proceed first to public comment. We can hear from the members of the public, and then we can begin board deliberation. So with that, I'd ask the clerk to call the members who request to speak on this item.
Thank you, Chair Fletcher. I will note for the record that we received 4 e-comments on this item. We have 3 callers on the line ready to address the board. As a reminder for the callers, if you do not wish to speak in this item, please hang up and call back when the board begins discussion of the next item. We'll be calling speakers by the last 4 digits of their phone number. They'll hear a notification that their call has been unmuted, and then you'll need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record, and you'll have 3 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. And I'll remind the public speakers that they should mute their TV or live video stream before they begin speaking. Aaron, if you could please identify the first caller.
Yes, our first caller is 4978. 4978.
Good morning. My name is Richard Golden. Elected officials need to stop acting like better vaccine distribution to 2% of San Diegans will make all of our problems go away. It will not. Yes, we do need better vaccine distribution. Thank you for that outstanding brief. Vaccines alone will not significantly reduce the RT for many, many months. We need to suppress and contain this virus now. If we don't, the nightmare will continue into February, March, April, and May. We can suppress the virus through outstanding personal responsibility in 3 weeks. The virus does not spread itself. People spread it. Simply choose not to get infected, and that helps people who do not have that choice, like our hero healthcare workers and essential frontline workers. It is your duty to humanity to do everything in your power not to get infected or infect anyone else. With less than outstanding responsibility and politicians and local media encouraging civil disobedience, reckless endangerment, and law breaking, we will need more than just personal responsibility. We need local government suppress and contain programs. Many of these programs cost little or no money at all. Many other experts and smart people came up with these programs. Since there are way too many to mention, they were sent via email. Please respond. Thank you to our hero healthcare workers and essential frontline workers, and thank you for your time. Thank you.
Thank you. Our next caller is 9886. 9886. Please press *6 to unmute yourself. 9886. If not, we will go to 6784. 6784.
My name is Marty Martinez. I have provided public comment on this agenda item at the last 6 county board meetings. For the new board members, here is the best summary I can provide in 3 minutes. The Constitution. The order of the health officer and emergency regulations is unconstitutional. Gathering limits violate the First Amendment. Stay-at-home orders violate the Due Process Clause of the 14th Amendment. And business closures violate the Equal Protection Clause of the 14th Amendment. This fact has been established by numerous courts around the country, including the state of California. Each member of this board has taken an oath to support and defend the Constitution as a public servant to we the people. The testing. The basis for understanding and interpretation of a COVID-19 case is flawed because the RT-PCR test, which is based on nucleic amplification technology, should not be used as a diagnostic test. This is consistent with CDC document number CDC-006-00019, dated July 13, 2020, page 38, first bullet. The interpretation of the test results is dependent on the number of cycle thresholds used to conduct the test. And for best interpretation, the number of cycles should be reported to the doctor and the person being tested. According to Dr. Fauci, anything more than 35 cycles just represents dead virus. How many cycles are being used for the test conducted in our county? Also, the PCR test was approved for emergency use, and as a result, the Clinical Laboratory Improvement Amendment was waived. This amendment establishes quality standards to ensure accuracy and reliability. There is no standard for these tests. Vaccines. The Pfizer and Moderna vaccine trials did not use the virus and did not test for prevention of transmission. This was admitted by Talzac, the person responsible for development of the Moderna vaccine. These vaccines are liability-free products for the vaccine maker. These vaccine companies and the government have entered into public-private partnerships, not subject to the Freedom of Information Act. According to Robert F. Kennedy Jr., nephew of U.S. President John F. Kennedy, nearly 10 years ago, 4 of the best coronavirus vaccines were selected and tested on animals. Initially, the animals showed a good response, but when exposed to the wild virus, they all died of inflammation in all their organs. The requirement for animal testing was waived for the SARS-CoV-2 vaccines. These vaccines are still experimental, and some deaths are even being reported. This is a small portion of nearly 20 minutes of public comment. I look forward to your questions. Thank you.
Thank you. Our next speaker is 4974. 4974. Please press *6 to unmute yourself.
Hi. Good morning, Board of Supervisors. My name is Michelle Krug, and I am a member of one of your boards and commissions, the persons with disabilities. We had our meeting yesterday, and one of the things that is really coming up about disabled people and seniors is a lack of knowing what to do around the virus. I heard the presentation, so I can, in addition, say that the concerns are, what do people do if they don't have insurance, if they're not, like I'm on Kaiser, but others that are not, how there's not clarity within our communities, particularly in the disabled community, about how to access these things. So I just want to ask that the knowledge that the communication is really going to have to be far and wide in terms of reaching these enclaves of people that typically are disconnected from the normal social media. Thank you.
Thank you. We'll return to 9886. 9886. If you would like to address the board on item 4, please press *6 now. 9886.
Hello, this is Joanne Fields with the COVID-19 Task Force. I'd like to thank the briefing by Director Nick Machone and his staff, also for their focus and resilience during this difficult time. The briefings are very helpful and informative. I really want to thank Deanna Zotalis Ferrer of his staff as it pertains to the COVID-19 testing sites in the South Bay. We have received concerns of being denied free testing due to the lack of health plans and availability of appointments. Appointment waits in the South Bay were almost a week long, and she tried to address that right away. We also appreciate the community engagement. While we are still waiting for disaggregated data, we hope with this new Board of Supervisors that we will see that be implemented. Again, disaggregated data so that we can defend the needs of the Filipino and Asian Pacific Islander communities. Last but not least, we are very excited to see the Super Vaccine Center unfold and give access to our healthcare workers and essentially the whole county of San Diego. There's a senior project manager for information services and facilities, Marlon Austria, who is a very active member of the Filipino community. We're glad to see his work along with your team. Again, execute something that has never been done before in the county, and we hope to resolve the COVID-19 pandemic sooner than later, and we appreciate being a partner with all of you. Thank you.
Thank you, and that concludes public testimony on this item. Chair Fletcher.
Thank you for that update. 2021 has brought us both good news and bad news. The good news is we have a vaccine that is here, and we are moving forward with vaccination, which is the light at the end of the tunnel. I think there's general agreement that the kind of clunky nature of how they've been distributed, the lack of federal funding to help administer them has caused a difficulty. But I am proud to say as a county, we are stepping up to do whatever it takes to get as many vaccines in as many arms as possible. The 4 initial pods we stood up, obviously the Super Center pod that we recently stood up, are a step in the right direction, but we're doing so much more to work with our partners and helping and assisting their vaccine administration. And I know as a county, we want to continue down that effort. The faster we get vaccines distributed, the faster we get to herd immunity, the faster we open up all aspects of our economy and get our way of life back and our society back. And so I want to commend the very difficult work when you have so many entities involved in so many different ways. It is a great challenge, but I want to commend our T3 vaccination team for the efforts that they're doing, along with continuing everything else. Dealing with the vaccine is additive to everything else that we were doing and continue to do. And that is encouraging. We have a lot of work to do. We have a lot of things to figure out. We've got a lot of effort that remains to have to be made. But I do think that we are doing everything can. And I think it's great to see locations around the state that are replicating what we launched with the Padres at Petco Park. In the 3 to 4 days after we made that announcement, we saw LA do something similar. Orange County is now doing it. And I think that, again, is encouraging for our whole state. The bad news in 2021 is that this virus continues to spread in an out-of-control manner. As you heard from Dr. Wooten, there were periods of time where we were having 200 cases a day. We now have days with more than 4,000 cases per day, which tells us the spread is widespread. And when you get that many people, it will transmit to more people. And then you get the presence of the much more contagious UK strain, which we know is here and we also know is widespread, tells us that we still have work left to do in tackling the spread of COVID-19 while we are simultaneously ramping up vaccines. In an effort to preserve the integrity of our healthcare system, we're all aware of the tremendous strain that has been placed on our healthcare system. And I just want to commend our hospital systems for the heroic work that they're doing in order to free up space for COVID patients. When you look at the hospitalization data and charts, you see a massive jump in the number of COVID patients, and you see a significant shrinking in the number of non-COVID patients. Those are San Diegans who are not getting the care that they need because they have to free up space for COVID patients. And the best way that we address that situation is slowing the spread and getting this under control. I'm also incredibly encouraged by the new availability of significant state funding to help our businesses. The hundreds of millions of dollars that are being put in to help and assistance of businesses is going to be, I think, a welcome relief. Obviously, they all want to get back up and working, but while we get this thing under control and while we distribute the vaccines, I think that is a valuable tool that, frankly, we did not have earlier when we saw the surge. And the recently passed federal stimulus efforts, again, are going to significantly help our businesses that are being impacted, which ought to make our ability to get through the measures put in place to slow the spread easier for those that are most impacted. And so, you know, we face our biggest challenge here with the logistics and the execution of vaccine, our biggest challenge with slowing a spread that continues to climb. And we know the lag of hospitalizations we're likely to see the impact on our hospital situation get worse before it gets better. But I am hopeful that with our board's continued commitment, with the federal and state assistance, with the vaccine here, we can begin to chart a path out of this. So before we go to board discussion, I will put a motion on the table to guide our discussion, and then we can have a thorough discussion. And so I would move that we adopt the COVID recommendations as outlined in the board letter, recommendations 1 through 5. I would add to that a motion that we continue the Great Plates program. I think that this is a valuable program. It is a small county investment to utilize state and federal funds, and I think it has served the needs of people who are in need, and it has helped our restaurant industry, and I'd like to see us continue that program. And then I would also add that we, on the enforcement item, adopt the 2 additional tiers on enforcement that were considered by our board at our August 4th meeting, and that is for those that are not operating in compliance with safe reopening plans, along with proactive inspections. I think that will help us when we recognize that we went from 30 to 40 complaints a day to hundreds and hundreds of complaints a day. In order to keep up with that, I think it's important that we increase our posture surrounding that. So I would make that motion, and we will now go to a board member discussion. I see Vice Chair Vargas, and then we will go to Supervisor Anderson and then Supervisor Desmond. Vice Chair Vargas?
I would like to thank you, Supervisor Fletcher, Chair Fletcher. I would like to second the motion, but would like to offer a friendly amendment to that motion, the item numbers, the action items. That is part of enforcement. We also say that businesses who have violated public health orders and have multiple cease and desist orders will not qualify for business relief funding as well.
I'm happy to accept that.
Thank you.
Just taking a note there. Okay, we'll now go to Supervisor Anderson.
I'd like to offer a friendly amendment, and that would be, it's recognized that the residents and business owners of San Diego County should have fair and consistent application of enforcement actions against those deemed to be in violation of COVID-19 safety regulations. And it's recognized that scientific data on how COVID-19 is spread should be the guiding principle determining what businesses should be open and how they may operate. And once determined, the criteria should be released publicly. And then finally, the County of San Diego enforcement action against residents and businesses deemed in violation of COVID-19 will be based on scientific evidence and applied consistently. The County of San Diego enforcement's criteria, once determined, should be released publicly. I'd like to add that as a item number 6.
Thank you. Thank you, Supervisor Anderson. I have no problem accepting that friendly amendment. I would ask you to send the language to the clerk so he can include it in the minutes. All of the efforts we're taking, again, under the leadership of Dr. Wooten, are guided by scientific data surrounding how the virus is spread. And I agree that our enforcement should be consistent and we can be transparent. So I have no problem with that. The seconder of the motion is also okay with that?
Yes.
Okay, thank you. We'll now go to Supervisor Desmond.
Thank you very much, Mr. Chair. Appreciate that. I appreciate staff for your report and all the great work that's been done. And I know you stretched very, very thin trying to do all the testing, and now the vaccination is under the same group of people. And so I really appreciate that. Last week, I had a vaccine town hall with our county health officials. I want to thank all our health officials for taking the time out of their busy, busy schedules to talk with my constituents. We had over 700 people on a Zoom call, and they were all wondering pretty much the same thing. And I know Nick, you pointed it out a bit, but many people are still out there frustrated with the vaccine and the rollout, and they want to know when they can get the vaccine and how they can sign up for more information. We've received hundreds of emails and phone calls from local medical offices to regular people asking how to get the vaccine and for more information. We tell them to go to the website, and they call back sometimes and they say they can't find what they're looking for. They don't know what tier they're in or where they go. So I know the website is very intuitive to us, but it's not always easy for constituents. So I'd like to ask that our county health officials, who I know are working very hard on many things, if we can create, a button or something like that that's easy to find in the website that allows people that aren't even in the tiers yet, like I know we can do it for 1A, but allows people to sign in, fill out their information, receive a notification of what tier they're in, and then be able to request notification when the vaccine for that tier becomes available and where they can go to get it. So basically, let them know what tier they're in, notify them when their tier is up for the vaccine, where they go to get it, and then secondly, I guess, to notify them for the second vaccination. I think that'd be very helpful and kind of comforting to people who are in the system, knowing that they're in the system and they're going to get notified. Because even when I look at some of the tiers, I'm not quite sure, where some people where we get calls from fall in place. So that would be very helpful if you could do that. I don't want to overburden anyone, but that was what I heard on my Zoom call of over 700 people.
Supervisor Desmond, if you're okay, would you be okay if Nick Machione comments on that? Because I think that is a real and pressing concern and issue and something I know they're working on. And would you like him to just update you on that specific suggestion and what they're doing to try and address that?
Well, if you want to do it right now, that'd be fine, but I still have other comments to make.
Sure, so we'll come back to you. We'll come back to you.
Thank
Nick?
you.
Thank you, Chairman Fletcher and Supervisor Desmond. As I alluded, we are working on, indeed, what you're describing. At the direction of the board subcommittee, the desire was to create a single customer portal on our county website that would be open to all San Diegans, and the ability to, one, put in some of their information that would then tell them where they stand in the different phases and whether they were eligible immediately, and if not, by providing, this is all voluntary, the information through email or text, that they would then be notified when they are eligible with information of where to go if their medical provider wasn't available. For instance, if they had Kaiser Permanente, we would tell them to go to Kaiser Permanente because they are providing vaccine for their Kaiser members. But if they didn't have a provider or such, they would go to one of our sites and we would tell them how to register. So that's indeed the system we're putting together and trying to stand up as soon as possible.
All right, you're already on it, which is good. I just want to let you know my huge Zoom call was generated, so I appreciate, and you were there, so I appreciate that. Also, I just want to say I support the staff's recommendations. I support the Great Plates, but I can't support the increased enforcement on businesses. I'm all for increased education, making sure enforcing health and safety protocols, but not on closing down businesses. I'm chastised for going out and talking to businesses that have remained open, trying to hear from them. And what I heard from them is their primarily complaint is they're being discriminated against. Business sectors are not all being treated fair and equally. I believe all businesses should have the opportunity to be open and operate safely and follow all the safety protocols and allow peaceful protests. It doesn't say you can't serve food at a protest. So I support the staff recommendations. I'm not going to be able to support the increased enforcement at this time. I think if you treat people like adults, they'll act like it. Thank you.
Thank you, Supervisor Desmond. Any other board member comments or questions?
Chair Fletcher, one thing that I'd like to add that on Vice Chair Vargas's amendment, I'd like to add just a provision in there that says, excuse me, to the extent legally possible. We haven't looked at whether the different programs, relief programs, would allow that kind of a restriction, and so we'll just have to do that to the extent legally possible if that's appropriate. Fair enough.
Fair enough. So what I'm going to do real quick is just summarize the motion that is on the table. We have a motion by myself, and then we'll go to Supervisor Lawson-Remer. We have a motion on the floor by myself, seconded by Vice Chair Vargas, to adopt the 5 staff recommendations to include the continuation of Great Plates 1 and the income stipend program as drafted at current levels, to continue them, along with the increased enforcement for operations that are not complying with the safe reopening plans and allowing for proactive inspections. A additional item there is, to the extent legally possible, to not provide financial assistance to entities that have been deemed in violation of public health orders with cease and desist letters who continued in operations in opposition to those measures, and then to adopt Supervisor Anderson's language about fair and consistent application based on scientific data around how COVID-19 spreads, and to ensure that our enforcement efforts are being applied consistently. So that is presently the motion on the table, and now we'll go to Supervisor Lawson-Remer.
Thank you very much. I'm strong in support of both the original motion and the 2 amendments. I just wanted to add potentially a small friendly amendment or clarification to Supervisor Anderson's amendment, which is to just ensure that we are cognizant that we're in a really difficult moving environment with a lot of data limitations. So we're giving staff sort of the flexibility to use the data that is available and not try to look for data that is actually not available, which would then make their efforts really difficult. To make sure that they're empowered to be proactive in finding the best available data sources.
I'm fine with that. I think the biggest challenges, at least from my district, are the inconsistency of how it looks in enforcement, how mom and pop shops are the target while other big boxes aren't the target, and the inconsistency of the transparency of why we're doing what we're doing. And I think that if people understood why we're doing it and it was applied in a fair manner, I think that would get more compliance. And that's the goal, is to use that science-based across the board.
So Supervisor Anderson, we'll take your drafting and just add the data available. But I think the intent behind it, we all agree with it.
Agreed.
Yeah.
Okay. All right, we have a motion and a second. We've outlined what's in it. Seeing no other board member requests to speak or comments, if there are no questions from the clerk or council, I would ask the clerk to call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
No.
Vice Chair Vargas?
Aye.
And Chair Fletcher?
Fletcher, aye.
Mr. Chair, that motion passes with Supervisor Desmond voting no, all other supervisors being present and voting aye.
Thank you all. We'll now move to agenda item 5, adopt a resolution of the San Diego County Board of Supervisors providing authorization to participate in the 3rd round notice of funding availability for the No Place Like Home Competitive Alternative Process Allocation Funds. We will get a presentation from staff. I think this is an important program for us to understand what we're doing, why, how, the opportunities and also the limitations. And so with this, I will turn it over to staff for their presentation. We'll give them a second there to get set. And then we will turn it over to staff for a presentation on this item.
Thank you, Mr. Chairman. Let me introduce David Estrella. He is the Director of our Housing and Community Development Services. David?
Good morning, members of the board. My name is David Estrella, Director of Housing and Community Development Services. I'm joined by Kelly Salmons, Chief of Community Development. Today, we are here to request authorization to participate in the third round Notice of Funding Availability, otherwise known as a NOFA, for the state-funded No Place Like Home program. This state-funded program invests in the development of permanent supportive housing for persons who are in need of mental health services and are experiencing homelessness, chronic homelessness, or who are at risk of chronic homelessness. Through this program, it is estimated that the County of San Diego is eligible to receive approximately $117 million in total program funds through the end of the fiscal year 2023-24, of which the county has received approximately $80 million. I will provide a brief overview of the program, review the funding allocation to date, and share the program's regional impact. The No Place Like Home program, implemented in 2018, allocates state funds to counties for the distribution of loans and/or grants designated for the development of permanent supportive housing. Eligible use of funds include acquisition, rehabilitation, new construction, and the preservation of permanent supportive housing. Lastly, developers may apply for a capitalized operating subsidy reserve, also called a COSAR, to help cover the costs associated with the No Place Like Home units. This program allows the County of San Diego to provide the financing needed to keep our most vulnerable residents in stable housing across the region. No Place Like Home units, assisted units, are set aside for adults with serious mental illness and children, adolescents with serious emotional disturbances who are homeless or at risk of homelessness, providing access to stable, affordable housing and services. The program design also includes the blending or integration of No Place Like Home units with non-No Place Like Home units, promoting inclusivity and sustainable long-term operations. Highlighted in this slide are some of the supportive services that are made available to residents of No Place Like Home assisted units. Services will be individualized based on the tenant need. The County of San Diego's Behavioral Health Services will provide a range of services individualized to the needs of residents. These include outpatient care, incorporating strength-based case management, and a comprehensive wraparound model of care. The county has committed to providing services for no less than 20 years to individuals and households residing in assisted units. The coordination of care also includes working closely with the property managers and housing developers. This collaboration is essential to ensure residents are successful in attaining and sustaining housing. Next, we will review the funding allocation that makes this work possible. The County of San Diego is eligible to receive a total of approximately $117 million from two separate funding allocation categories. The non-competitive program allocation is based on the proportionate number of homeless persons residing in San Diego County compared to the state's total homeless population. The County of San Diego has received a total of $12 million under the non-competitive allocation. The second category is the alternative process county allocation, which is available to counties with at least 5% of the state's homeless population. These counties must demonstrate capacity to directly administer program funds. It is estimated that the County of San Diego is eligible to receive approximately $104 million in No Place Like Home program grant funds over the course of 4 funding rounds. Since the start of the No Place Like Home program, San Diego County has received $28 million through our participation in Round 1 and $40 million through Round 2. Today's action focuses solely on the third round. With the board's approval, our participation in the third round NOFA would make $12 million available for the County of San Diego. To date, the county has received approximately $80 million in No Place Like Home funds. Through an open NOFA process, 6 developments have been awarded loans, totaling approximately $53 million. Reflected on this slide are 6 developments currently underway, working to provide permanent supportive housing to the region. Windsor Point is a development of affirmed housing located in the city of Carlsbad. This development is currently under construction, delivering 24 No Place Like Home units and a total of 50 affordable units to the region. The grand opening is anticipated for January 2023. Next, we have Jamboree San Isidro Apartments, a Jamboree Housing Corporation development that will add 25 No Place Like Home units, along with 65 affordable units to the area. This development is scheduled to be online with a grand opening set for December 2022. 14th and Commercial is a Chelsea Investment Corporation in partnership with Father Joe's Villages Development, located in the city of San Diego. This development is also under construction, set to add 60 No Place Like Home units and a total of 326 units to the region. The grand opening is scheduled for July 2022. The Iris Apartments, a national core development located in San Isidro, will include 100 units for low-income families. Of these, 15 will be designated as No Place Like Home units. Groundbreaking for this development is set for December 2021. Anita Street Apartments, a Wakeland development, will create 24 No Place Like Home units within the 96 affordable unit development in the city of Chula Vista. Groundbreaking is set for March 2021. Lastly, Valley Senior Village, a 50-unit development by National Core located in Escondido, will include 24 No Place Like Home units. Groundbreaking for this development is scheduled for December 2021. In summary, through funding provided over the last 2 years, a total of 172 No Place Like Home units will be created for vulnerable San Diegans, providing housing and supportive services for individuals with serious mental illness who are experiencing homelessness or are at risk of homelessness. In addition, these developments will increase the total affordable housing inventory in the region by 687 units and leverage over $270 million in other funding. Through the No Place Like Home program, third round NOFA, the County of San Diego will receive approximately $12 million of state funds that will serve to advance our efforts to develop permanent supportive housing throughout the region. Development proposals that meet the minimum threshold requirements and are deemed financially feasible and project ready will be awarded loan funds available to developers through the county's open NOFA process. Today, we're requesting that your board authorize the participation in a third round NOFA for the No Place Like Home program competitive alternative process allocation. This includes the authorization of the agency director or designee to execute, accept, and administer all documents necessary to implement the award of funding, as well as authorize HHSA to commit the county to provide mental health services for at least 20 years for No Place Like Home funded units. This concludes our presentation. We thank you for your time and are available for any questions you may have. Thank you.
Thank you. Thank you for that presentation. I'll ask the clerk if there's any requests for public comment on this item.
Thank you, Chair Fletcher. There are no requests to speak on this item.
All right, I'll turn it over to board members. Any board member comments or questions on this item? Seeing none, I will make a motion to approve the staff recommendations in item 5. Is there a second?
I'll second. Everybody's.
All right, we have a second by Supervisor Anderson. We have a motion and a second to adopt the resolution on agenda item 5. Seeing no additional board member comments, I would ask the clerk to call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Aye.
And Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
Thank you. We have 5 agenda items left. We're at almost 11 o'clock. We're going to take again a short break for staff and everyone at noon. So I think what we will do, item number 8 has a significant number of speakers. So I think we will try to get as many of the others done as we can before we recess briefly at noon, and then we'll come back and finish the rest and then do item 8. So the next item that we'll consider is agenda item 9, framework for our future, ensuring transparency and open government in San Diego County. This is a board letter brought forward by myself and Supervisor Anderson. I'll just make some brief introductory comments, let Supervisor Anderson do the same, and then we will hear if there's any from any public speakers who are on there. You know, this is a part of our framework for the future of county government, and I think foundational to good government is not only transparency, but more opportunities for public engagement. And this policy will build on a lot of the work we've been doing over the last 2 years, trying to increase accessibility and engagement with the county. And I appreciate greatly Supervisor Anderson's partnership in this effort. These really are just the first steps to improve our transparency, our openness, creating a board subcommittee that can really explore all of the various ways that we as a county can operate in a more accessible an open way, including things like looking at Public Records Act portal, archived public records, email retention, board and stakeholder engagement, and so much else. This action would create a board subcommittee of Supervisors Anderson and Vargas that will continue to work on these items and bring back policies and changes and things that we can consider. And I think this is a good step forward, and I think something that is appropriate for what we're doing. With that, I'll turn it to Supervisor Anderson.
Well, Mr. Chairman, I just want to thank you again for your support, and I look forward to working with Vice Chairwoman Vargas. Look, transparency is the cornerstone of good government, and I think this is a big step in that right direction. So I really appreciate it, and I look forward to working with the whole board with new and innovative ways to make sure that our constituents know exactly what we're doing and why we're doing it.
Thank you, Supervisor Anderson. Let's go to public comment, and then we can go to board deliberation. I asked the clerk to call any requests for speakers.
Thank you, Chair Fletcher. Also note for the record that we received 5 e-comments on this item. Any members of the public that requested to speak on this item, please dial into the conference line now using the instructions that were provided to you. I see we have a couple callers joining us. We'll be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your line. Each caller will be asked to state their name for the audio record, and you'll have 3 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. Aaron, if you could please identify the callers.
Yes, we'll begin with 4974. 4974.
Good morning again, Michelle Krug. I wanted to again address around issues around the boards and commissions. It would be really helpful, and I'm not sure why there's pushback on the boards and commissions being more transparent as well. In the city of San Diego, those meetings for every board and commission are recorded, and especially since we're doing them on Zoom, it would seem a no-brainer to have them recorded and have them put on the website. I recognize that the county has a lot more boards and commissions than the city does, but I think that it would be really helpful for people who cannot make those advisory meetings to have an idea of what's going on, because for the last 9 months at least, we've had guests coming in to see what's happening on ours because they're feeling a lack of communication. So please consider having those more information, I guess, also when people's terms are ended, things like that on the website, but specifically the having them recorded so that people can listen to them afterwards. Thank you.
Thank you. Our next speaker is 2533. 2533. Please press *6 to unmute yourself. 2533.
Good morning. This is Livia Bowden on behalf of Coastal Environmental Rights Foundation. I just wanted to briefly commend the board for bringing this item forward. It's been really hard in the past to obtain documents from the county through the Public Records Act, and I think this is definitely an improvement, and we look forward to seeing further improvements as the process plays out. And also in this digital age where during this pandemic, things are increasingly being done electronically, and we're even more reliant on sources of information digitally, I think it's really important to review and potentially revise the records retention policy. And so I just heartily support the board moving forward with this item, and thank you for your time.
Thank you. Our next speaker is 1104. 1104.
Good morning, everybody. Thank you, Board Chair Supervisor Fletcher and the entire Board of Supervisors. My name is Jerry Hall. I speak in support of the item number 9. I speak as a longtime open government, open data advocate and technologist. I'm also a current member and past captain of the local Open San Diego, which is one of the nearly 75 brigades of the nonprofit Code for America. I believe there are myriad benefits to the entire county and region, both economically and socially, when we ensure critical data is made available in an organized, machine-readable, and consistent basis. When governments ensure they have solid open data policies and practices, they improve opportunities for greater awareness, efficiency, and opportunities for innovation. Many internal and external entities benefit from more open data. That includes researchers and universities, service providers, advocacy organizations, commercial entities, and the general public. Data in the areas of health, education, criminal justice, and the climate are all intertwined, allowing us to innovate in areas, especially like the other item on today's agenda, racism as a public health crisis, more effectively when available on a timely, machine-readable, and consistent basis. Although we haven't yet adopted a ubiquitous open data policy and practices, the good news is that many other counties and municipalities have. The upshot is that we can learn from them quickly to identify and adopt advanced policies and best practices, allowing us to more successfully innovate quicker. An important element for us to be mindful of is that data can be a double-edged sword. Although data might seem innocuous to an entity intending to improve one facet of a service delivery, for instance, that same data could be used overtly or through historic systemic design to harm our Black, Indigenous, and other people of color, BIPOC neighbors. Rather than lock out all entities from the data, we should develop varying levels of availability, the default being to make the data more widely available. My hope is this advisory committee be bold and intentionally ensure their work accelerates our ability to more equitably serve every San Diegan, and by extension, any other county that follows our lead in open data model. Sunlight is said to be the best of disinfectants. It's a great quote by Louis Brandeis, and I thank you for your consideration.
Thank you. Our next speaker is 6781. 6781. Six, 781, please press *6 to unmute yourself. And if we don't hear from you, we'll go to the next speaker and come back to you. Our next speaker is 6353. 6353.
Good morning. Before I start, I would like to request that the SEIU letter we have submitted be brought up. My name is Alicia Shirley, and I am a proud member of SEIU 221. I work at the county as a supervising office assistant, and I have served the county for nearly 10 years. We are here in strong support of the transparency and open government proposal. For too many years, the county's policy has been to withhold information from the employees and the public. We think it is better if the public has more information because it will help with better decision making. In addition to passing this proposal, there is something this board can do to show your commitment to transparency. As you know, Chief Probation Officer Gonzalez has announced his departure. We think the county workforce and the county would absolutely be served best by the process where the public can weigh in on the criteria for the selection and hear about the values and priorities of potential candidates. We are asking that the board prioritize a new CPO who will respect professional, institutional, and clinical staff, who will commit to relevant and inclusive communication, who will advocate for equitable pay and accurate job descriptions, and who will continue to use a trauma-informed approach focused on restorative justice. SEIU has sent a letter to each of the Board of Supervisors with this request. Taking action on this request is an opportunity to show your commitment to transparency through action. Thank you for your consideration.
Thank you. And for the record, we did show the letter that was sent to all the supervisors on this group. Thank you.
Thank you. Our next speaker is 6781. 6781. You're the final speaker on this. Oh, here we go.
Hello, good morning. My name is Juan Carlos Davenport, and I'm also calling today as a representative of the members of SEIU 221. I am a records clerk in the probation department and have worked for the county for 5 years. I fully agree with everything Alicia just said about transparency and urge you to vote yes on this agenda item. Transparency in government is essential. The appointment of a chief probation officer affects not just SEIU workers, but the community at large. That's why the letter we are delivering to you is so important. We are asking for a chief probation officer who will respect professional, institutional, and clinical staff. For too long, we have been ignored and overlooked by top brass in the department. We are a vital part of this organization, and without us, the department would not be able to function. And that is overlooked far too often. Our next leader should recognize and respect this fact. We are asking for a chief probation officer who will commit to communication that is relevant to all staff. We expect equity, whether that is through advancement opportunities without favoritism or developing a workplace where speaking up is encouraged. We are seeking a chief who believes in ongoing positive change for staff and for our community. We are asking for a chief probation officer who will be an advocate for equitable pay and accurate job descriptions. They should have a hand in making sure the compensation study is done fairly, considering the full scope of essential responsibilities fulfilled by professional, institutional, and clinical staff. And last but definitely not least, we are asking for a chief probation officer who will continue to use a trauma-informed approach with a focus on restorative justice. We know that challenges like housing, insecurity, poverty, mental health conditions, and substance abuse increase the likelihood of violations and incarceration. In response, trauma-informed practices paired with programs dedicated to treatment and ongoing support must remain at the center of our work for both juvenile and adult clients. We urge you to prioritize transparency and community input throughout this process. Thank you very much for your time and for allowing me to speak to you all today.
Thank you. And that concludes public testimony on this item. Chair Fletcher.
Aaron, we have one more individual that's requested to speak. Last four digits are 9886.
Hello again. This is Joanne Fields with Asian Pacific Islander Initiative. Thank you, Supervisor Fletcher and Anderson, for bringing this item forward. And we are in support of the transparency and also to ensure participation is strongly encouraged. I'd like to point to Andrew Strong, Chief of Staff of the Chief Administrative Officer, who has included the Filipino and Asian Pacific Islander community in a series of training with mid-management staff to learn the diversity that it resides in Central San Diego, specifically Southeastern San Diego. We believe the establishment of the Transparency Advisory Committee can help further such trainings throughout the County of San Diego and more importantly, strengthen the relationship with communities that have been underrepresented and underserved. Thank you.
Thank you. And now I believe that concludes public testimony on item 9. Chair Fletcher.
Thank you. I will make a motion to approve the board letter and agenda item 9. Is there a second to that motion?
Second.
Second by Supervisor Anderson. Any board member comments? Supervisor Desmond.
Thank you very much, Mr. Chair, and thank you for bringing this item forward along with Supervisor Anderson. I'm glad to see more transparency coming to the county. I've always been in favor of being transparent, and I will be supporting this item. I was glad to see, though, in the recommendation 4 that the committee formed will be reporting back to the board regularly with progress updates. I have to tell you, last year, one of the things that surprised me, or 2 years ago, really, with the COVID-19 task force, is that the committee was doing press conferences and answering public questions, in some cases before the full board had the information, and in most cases before the full board had any time to weigh in. I realize this was COVID, there's a lot of moving parts and things like that. It was kind of surprising, though, to get our board information from press conferences. So that was a bit frustrating. So I just want to make sure that all the established committees, report back to the board. Should not be getting ahead of the board with recommendations on behalf of the county before the board weighs in. So I would like to see that as we develop these advisory committees, that the committee is a committee of the board and should report back to the board with recommendations before any sort of implementation. So I think also, though, to enhance the transparency, especially with these committee meetings, and from what we're hearing on the callers, I think we should make the committee meetings compliant with the Brown Act. By making these committee meetings subject to the Brown Act, it's going to serve the public, because then there's going to be notifications of the meetings, there'll be agendas, there'll be more enhanced participation, there'll be minutes, there'll be data, material, PowerPoints for the public, and they'll be more enhanced and engaged and informed and involved. So I think I realize there's only going to be 2 board members, and that doesn't require the Brown Act, but I think we should be compliant with the Brown Act so that the public has as much notification, data, and information, and be as transparently as we possibly can be. So I'd like to ask maker of the motion if be willing to make these committee meetings Brown Act compliant.
Well, Supervisor Desmond, I'd want to hear from the 2 members who are going to be on the subcommittee. I think that they certainly have the option to do Brown Act compliant procedures when they're going to have a public meeting. The 2 of them may have meetings that are a part of this process with data or other types of folks that would be more conducive and better having the option to, when they're having a public meeting with members of the public, to do that, but to retain the ability to meet amongst themselves at times. I'll also say that any recommendations that come out of this group would come back to the full Board of Supervisors. And so any discussion surrounding that, of course, would be entirely compliant with the Brown Act. And so I think we have a process in place for public meetings. I think they certainly have the ability to follow that when they're doing public meetings. And the advantage of a subcommittee structure is it gives them the flexibility to be able to do both of those. So unless the 2 members of the subcommittee feel strongly a different direction, I'm inclined to leave the motion as it stands.
I have to tell you, on an item about transparency, and then saying we still want to meet behind closed doors is abhorrent to me.
Any other board member comments? Supervisor Anderson.
We don't have the authority to do anything. If the supervisor would like to send us suggestions, we certainly could have a meeting that's in the public for additional suggestions. This doesn't preclude other people from participating, but it allows us to work and move forward and bring back ideas to the full board, so the whole board doesn't have a full day, 5 days a week, 7 days a week. We don't have the authority to move anything forward without Brown Act and without having the whole board participate. But
I'm just asking that
are you worried? I mean, is the question, are they worried about not being able to add additional items?
Well, as far as the board itself, I'm happy that you be coming back to the board before making recommendations. I just think if you're going to have committee meetings, that the public be invited to the meetings, they have the information, they're able to participate, and that your meetings are open to the public. So, you know, the closed door meetings are, to me, are very frustrating for the public because, you know, they hear about something that came out, they go, well, when was that discussed? And I think on a transparency meeting or item, we want to be as transparent as possible and have as much public engagement as possible. And if you run the meetings according to the Brown Act, then you cover all those bases.
Supervisor Desmond, Chairman Fletcher, is that fine if I go ahead and?
Sure, of course.
So one of the items that we are going to be looking at is board and stakeholder engagement. And I think that that's a perfect opportunity for Supervisor Anderson and myself to look into this and also work with legal counsel to ensure that we are identifying some of the points that you've brought up. I think they've been duly noted, and I would not hesitate to begin. That could be one of our first conversations that we have. How do we do this better? I think Ms. Michelle Krug, who I adore, was on here talking about how do we make sure that we have our meetings recorded, et cetera. I think there's a lot of work ahead of us, and I'm not sure that this is the best place to, you know, roll up our sleeves and do it, but I'm sure that Supervisor Anderson and myself could do that in our committee, and then also make sure that we're getting additional information from staff and making recommendations, asking for those questions, bringing those recommendations to you so that you can provide feedback as well. That would be my recommendation.
Chairwoman, I don't mean to jump ahead of you, but in the brief conversation I had with you as far as visioning, at some point we are going to bring the public in for their opinion, and we want to hear from everybody to find out what would work best for the public. So I think that when we get to that stage, perhaps that's when the noticing would make most sense.
All right, we have a motion and a second. Any other board member comments? Seeing none, I'll ask the clerk to call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
I'm going to vote aye, but I'm just, because this is a movement in the right direction for transparency, but I'm disappointed that the meetings are still going to be taking place behind closed doors.
Vice Chair Vargas?
Aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
Thank you. We'll now move to agenda item number 10, Framework for Our Future, a collaborative, data-driven, and equitable response to COVID-19 in San Diego County. An action I'm pleased to bring forward in conjunction with Vice Chair Vargas. I will turn it to our Vice Chair for some opening comments, and then we will go to public comment.
Thank you, Chair Fletcher. You know, these are very uncertain times, and we have the responsibility to absolutely lead with conviction. We have to work collectively to break down some of the barriers and policies and procedures that for years have disproportionately impacted, policies and procedures that for years have disproportionately impacted the health and well-being of many folks in our communities. We have an opportunity today to stop the rhetoric, to stop politicizing public health, and be very solution-driven, because for too many lives are at stake. This resolution will ensure our response is health equity minded to begin prioritizing the most vulnerable communities and ensure they have the resources they need to be healthy and safe, and so that we all can get back to our routines. This is particularly important, I think, because as we're having conversations about COVID-19 and how we ensure that our communities get back into their daily lives, it's important to define what health equity means. And I'm going to use the Robert Wood Foundation definition, which means that everyone has a fair and just opportunity to be as healthy as possible. And this requires removing the obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair equity, fair pay, quality education and housing, safe environments, and healthcare. For the purpose of measurement, health equity means reducing and ultimately eliminating disparities in health and its determinants that adversely affect excluded or marginalize our groups. People in our county are hurting, especially in low-income and communities of color, and we need to ensure that as the county receives future funding for COVID-19 mitigation, we need to look at the data and prioritize and invest in the areas of greatest need, not simply award funding based on population. Health equity is critical, and it's something that I'm committed to continue to work towards beyond this resolution, and I urge my colleagues to support this board letter.
Thank you. Thank you, Vice Chair Vargas. I'll ask the clerk at this point to call any public speakers, and then we'll go to board deliberation.
Thank you, Chair Fletcher. Any members of the public that have requested to speak in this item, please dial into the conference line now using the instructions provided to you. I'll note for the record that we received 2 e-comments on this item. We have 5 requests to speak on this item. We'll be calling speakers by the last 4 digits of their phone number, and you'll hear notification that your call has been unmuted. You'll then need to press *6 to unmute your phone. Each caller will be asked to state their name for the audio record, and you'll have 3 minutes to address the board. You'll hear this sound when your time is up, so please conclude your comments at that time. Aaron, if you could please identify the first caller.
Yes, our first caller is 9886. 9886.
Hello, this is Joanne Fields again from the Asian Pacific Islander Initiative. Thank you for bringing this item forward. We appreciate that data will be driving this initiative. However, please do not forget we need disaggregated data to include Asian Pacific Islanders and specifically Filipinos. I see that it was pointed out there are prevalent cases in South Bay and southeastern San Diego, Filipinos being the second largest ethnic group in the county of San Diego, with a large percentage of Filipinos and Asian Pacific Islanders residing in these communities that I will gladly pass on to your staff for review. It is the data is also available on the SANDAG website. But again, we are not mentioned. And when we are not mentioned, it seems like we are invisible. Therefore, we are not part of the data. So again, please make sure to include our communities of Filipino and Asian Pacific Islanders and strive to include disaggregated data as it relates to COVID-19, not just the cases, but also the resources that are provided, language access, and testing, tracing, and treatment in our communities. Thank you.
Thank you. Our next caller is 3863. 3863.
Hello, can you hear me?
Yes, we can hear you.
Thank you. My name is Lisa Cuestas. I'm CEO of Casa Familiar in San Isidro in District 1. I support and thank you for presenting a more just, equitable, and science-driven approach to address continued COVID-19 responses and public health crisis awareness. However, my continued concern is the adequate prioritizing of future funds for the South Bay in your response to COVID-19 and a vaccine strategy, given our higher rates in South Bay. Why is there no vaccine superstation in South Bay yet? Splits by population and funding does not mean a fair or just approach. Majority of future funds must be appropriate to regions being impacted the most and into the hands of residents if we ever want to get our health and economy to a better place. Service and healthcare providers and nonprofits cannot continue to do more with less. We need your support in the South Bay. Thank you.
Thank you. Our next speaker is 4974. 4974. Please press *6 to unmute yourself.
Sorry, I pushed the *9. This is Michelle Cruz again, and I really appreciated the comments of the speaker just preceding me about South Bay. I think that the whole point of equity has to do with the resources coming to where they are most critically needed, which obviously affects our entire region. I am thrilled that this is on the agenda for our County Board of Supervisors. I think adding this into the culture from the top down, the bottom up has been pushing it for decades, is really going to be significant. So thank you very much, Supervisor Vargas and Nathan Fletcher. I really, really appreciate this item. Thanks.
Thank you. Our next speaker is 5961. 5961. Please press *6 to unmute yourself. If you'd like to address the board, please press *6.
My name is Iris Trammell, and I am a human service specialist with 14 years of service and a proud member and treasurer for SEIU Local 221. I want to support the county's proposal for an equitable, data-driven, and collaborative response to the COVID-19 pandemic. We need to double down on our commitment to support families impacted by COVID-19, particularly in the African American and Latino communities, which have been impacted the hardest. For county employees, I want to highlight two significant points. Number one, we need hazard pay to support county employees that have put themselves at risk during this pandemic. Number two, we need the county to extend the Families First Coronavirus Response Act. This was a federal benefit that expired on December 31st. We believe that President-elect Biden will renew the Response Act and make it retroactive. The members of SEIU want the county to support this initiative locally through COVID leave until the federal bill is passed. My family and I have been tested 3 times due to exposure from my work. This included my 89-year-old father who is suffering from Parkinson's disease. I could have potentially exposed him to the virus while taking him just to get tested. We were blessed to test negative all 3 times. This pandemic is also affecting my coworkers who are currently out of work and are using their own time or have exhausted all of their leave time. Please support county employees by providing hazard pay and extending the Families First Coronavirus Response Act. Thank you.
Thank you. Our next caller is 9358. 9358. If you'd like to address the board on item 10, please press *6 now.
Hi, my name is Angelina Corsani with the Center on Policy Initiatives and the Invest in San Diego Families Coalition. I'm here today to urge the board to vote in support of this item. The COVID-19 pandemic is bringing attention to and exacerbating health inequities in our country and in our county. Rates of COVID-19 infection, death, and COVID-related unemployment are disproportionately higher in communities of color. Although we may not be able to achieve health equity during this crisis, it is imperative that the county use its resources to keep these disparities from widening. County testing, treatment, and vaccination efforts, as well as the distribution of any COVID relief funds, must take an equitable approach, meaning communities that have been most affected should be prioritized. This is the most logical and effective approach. Targeting resources and efforts where they are needed most will obviously have and the benefits of this approach will extend to the county as a whole. Everyone will be safer if the county is responding to the pandemic in the most efficient way possible. Please ensure this county's commitment to an equitable approach in its COVID-19 response moving forward, and vote in favor of this resolution. Thank you for your time.
Thank you. Our next speaker is 3024. 3024.
Hi, my name is Katie Howlett, and I live in District 2. I just want to ask the board to support item 10, as it is imperative that we use the resources that we have to prevent the spread from widening, and the county must address the root cause of these disparities to equitably respond to the crisis. Thank you.
Thank you. And that concludes public testimony on this item, Chair Fletcher.
Thank you, and thank you to members of the public who weighed in. I think this item is of critical importance. Again, as we saw in our COVID update, we're seeing significant spikes, increases, taxing on our hospital systems. We have a vaccine coming, but that will not get us out of the present situation we face. And so I'd like to make a motion to approve item 10, and just want to read the recommendations that are coming forward in this board letter. To adopt the attached resolution entitled A Collaborative, Data-Driven, and Equitable Response to COVID-19 in San Diego County, which outlines the science-based and equitable approach the county will pursue working in collaboration with state officials in response to the COVID-19 pandemic. Find that the policy statements contained in the attached resolution supersede any contradictory policy statements contained in past Board of Supervisors initiative resolutions and letters related to COVID-19, and direct the Chief Administrative Officer to prioritize when appropriate the distribution of future COVID-19 response and recovery related federal, state, and local funds based on a data-driven approach that identifies communities requiring the highest need of support based on positive COVID-19 cases and takes into account health equity tools that measure degrees of disparity. Is there a second to that? Second by Vice Chair Vargas. We'll go to Supervisor Lawson-Remer and then Supervisor Anderson for comments.
Thank you so much. First, I just want to thank Supervisors Vargas and Fletcher for bringing forward this important item. I'm pleased to support this. After nearly a full year of dealing with this awful pandemic, science in the form of a vaccine is the reason there is light at the end of the tunnel. So this board is going to follow the science, period. We're going to take an evidence-based approach to COVID, rolling out vaccines as quickly as possible, scaling up testing, and providing a lifeline to small businesses and workers who have lost their jobs. Protecting public health and reopening the economy must go hand in hand. And following the science will get us to the light of the end of the tunnel. So I'm happy to support this item. I do, however, want to take a moment to highlight the comment of Ms. Trammell. I am very concerned about the limbo we are in currently, which disincentivize employees to take FFCRA or COVID leave. I also want to say to Ms. Trammell and her fellow county employees that I recognize and I'm very, very grateful for their tireless work during COVID. So I am optimistic that the new administration in Washington will provide more federal COVID relief, hopefully by the end of the month. And I am confident that this board will support using that money for the FFCRA program and that any days that county employees use now will be covered retroactively. So I actually have a question for county staff. And the question is whether we can support our employees now by providing a system to track any COVID leave that they need to take this month, which then could be retroactively credited to COVID leave if and when federal funding comes in and is made available under a new FFCRA funding mechanism. Thank you.
Westgard, CAO, to comment on that question.
Thank you, Supervisor and Mr. Chairman. Yes, absolutely. We can put in a special code in our PeopleSoft and our Chronos system so that we can keep track of that and then make a retroactive adjustment once we would receive federal guidance on that. So yes, absolutely. Thank you.
Great. Thank you so much.
Go next to Supervisor Anderson.
Mr. Chairman, I apologize. My computer is not working. It keeps putting my hand up and I'm not touching it. So I apologize. I don't mean to interrupt. I would just like to point out in this resolution, though, that Sandag reported certain communities as having some of the highest unemployment and some of the highest COVID-related incidences. And I think this is good scientific data to perhaps look at when thinking in terms of businesses and restaurants in what they're doing, because clearly it's sad that unemployed people are suffering so much, but it also, we should take that in consideration when looking forward on where COVID is focused. Thank you.
Completely agree. Thank you. Any other board member comments? Supervisor Desmond.
Thank you, Mr. Chair. I appreciate it. And, you know, I really appreciate the data-driven approach to fighting COVID-19. You know, this is much needed, and it's something that, quite frankly, I've been asking for as well. So, but however, you know, I disagree with some of the statements made in this board letter, specifically that the previous board was antagonistic. This statement mischaracterizes the board's intention of repeatedly requesting for local control. California is a big state, and one of the consistent and main points from the previous board's action was to advocate for local control. That we and our health officers could better determine the best response and actions for our county rather than a statewide one-size-fits-all. The board letter also chastises the previous board for asking questions, for sending letters to the governor in opposition to his executive orders. I didn't run for this job to be a rubber stamp, and I vehemently disagree that questioning the state's or anyone's actions on COVID should be labeled as irresponsible behavior. No one has all the answers to this novel virus. And to this day, still, no one has all the answers. Even Governor Cuomo is changing his mind about the lockdown, saying that soon there'll be nothing left to reopen. New ideas grow by asking questions and questioning authority, not blindly following the state with every decision. But we did follow the state primarily because of the money and permits and licensing threats from Sacramento. And your item number 2 and your recommendation, the board letter proposes to supersede any contrary policy statement that put forward by the previous board. So to me, the cancel culture has arrived. Cancel anything that's been said or done to contradict this board letter and what's being put forward. It's actually moot because if this passes, that would supersede it anyway. But working in a collaborative manner is preferred. But there comes a point where you have to stand up for the people that you represent. You know, we questioned the beach closures when the governor was considered closing them. We questioned the closures of outdoor playgrounds for our kids. The state hasn't always been right, and we've seen that with their reversals and succumbing to public pressure. I'm glad that this board letter seeks to put our resources where they are most needed. This is exactly what we need to do, as Supervisor Anderson stated. The board letter states that COVID-19 has disproportionately impacted communities of color, and it has. In Vista, 51% of the population in Vista is Hispanic or Latino, and they have just under 15% unemployment. In Oceanside, 36% of the population is Hispanic, Latino, or Samoan, and they are just under 15% unemployment. So I look forward to being able to provide resources to those most affected by COVID-19 in my district as well. But we also have, it's great to use a concept of data to drive our decisions. In fact, some of the court hearings recently have pointed out the fact that no data was even presented to support the closure of outdoor dining and the spread of the virus. Even Dr. Galley said the decision to include, among other sectors, outdoor dining and limiting that really has nothing to do with the relative safety of outdoor dining, but more trying to keep people at home. To me, that's discrimination against a business. And since the lockdowns and keeping people at home, our daily cases have gone from the hundreds per day to the thousands per day. Our First Amendment right allows freedom of speech, freedom of assembly, and freedom to protest against government. I will continue to work collaboratively. I think that's a noble cause, but I will not be silenced. And when I see oppression, arbitrary closures, or discrimination against anyone or any organization, any business, any school, or any church, I will question it and call for change. Thank you very much.
Thank you, Supervisor Desmond. And every member of this board is entitled to have their own opinion, to have their own approach, to ask questions when they will. And every board member, again, is individually accountable for the actions that they take. We have had the unfortunate and incredibly awkward situation, Supervisor Desmond, of having to send public health doctors out in the media to fact check false statements you've made, which puts us at a great disadvantage. I think you've misrepresented underlying health conditions and what you consider pure COVID deaths. And you have attacked the public health orders again, and the underlying science around the spread of COVID-19 surrounding them. I think what Dr. Galley outlined was the slowing of the spread by stopping the mixing of people when you have such high concentrations of cases in our region. And I don't think we can continually have someone undercut the public health orders in such an effective way and then complain that perhaps they're not working as well as intended when you're against them. And so we respect your right, Supervisor Desmond, as any member of this board has a right to fight for their perspective and their values and what they believe. and you will certainly always have the ability to continue to do this. And as in the past, the majority of the board will continue to set the prerogative and intention of the majority of the Board of Supervisors. And I think that's what this resolution seeks to do. With that,
I agree with that, and I understand, but in many of your statements in here, you're calling it irresponsible behavior to question anyone.
No, but I disagree. I disagree with the premise of your statement. I do believe things you've done have been irresponsible. I don't believe it is irresponsible to ask questions, but nonetheless, that's why we have a democracy and we have elections and we have votes. So, do you have anything else, Supervisor?
No, I think, thank you for the time, Chair Fletcher.
Always. Any other members of the board? We have a motion and a second on the table. Seeing none, I will ask the clerk to call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
Thank you all. We are rapidly approaching the noon hour. I think what we will do is take a brief recess. We want to make sure our staff and everyone has time to have a slight break. When we come back at 12:30, we will do item 8 first. We will resume the sequential order. We will do items 8, items 11, and items 12. We will knock those back when we come back at 12:30, and then we will adjourn into closed session. And so with that, we will stand in brief recess, and the Board of Supervisors meeting will reconvene at 12:30.